Good morning, everyone. Can you hear me? Wala, wala pa rin kasi akong audio. Yan. Can you hear me? May audio na ba ako? Ayan. Okay, thank you very much. All right, so the final coaching season has come. Yan, for me, ito yung start. Yan, so meaning to say, medyo malapit-lapit na talaga yung exam natin. And so for today, I will be discussing your final coaching for oral anatomy, physiology, and occlusion. So for those who are new, I am Dr. Salazar. Okay, so I will be handling the final coaching rationalization for this morning. So we will be meeting 6 hours, so 4 hours a day and another 2 hours on next Friday. So sa 18 to finish oral anatomy, physiology, and occlusion, and then start with oral histology and pathology naman. Okay? So I still develop the questions in a way, arrange the questions in a way that it's still arranged according to the topic outline during the intensive phase. Okay, so these are the topics that we will be able to discuss as we rationalize each question given to you. So we will be discussing your oral cavity. Okay, so we have questions related to that. Then introduction to the dentition. So this will include landmarks on the tooth. Yan. Yung mga characteristics, okay, general characteristics ng teeth. Then we have your primary teeth, okay, just general knowledge on primary kasi the board exam tells you to characterize or differentiate a primary from a permanent tooth. Then we have occlusion, okay, and then you have the tongue, salivary glands, muscles of mastication. Then we have the temporomandibular joint and mandibular movements, and then we have the cranial nerves. Okay, so today we will be discussing 2/3 of your final coaching material. So around 67 questions, hopefully matapos natin today. Okay, so let us now discuss the oral cavity. Okay, some of the items listed here are in Q&A form just to refresh your memory. Kung ano yung mga structures sa oral cavity natin and sa mga teeth natin. And then I'll be giving you a copy of this because I received a message asking for a copy. Sorry, I forgot to make a PDF copy of this. Okay, but I'll be sending a copy. Okay, don't worry. So all you have to do is to listen and take notes. Kung walang mga notes, wala dun sa PowerPoint, you could take down notes. Okay, so let us now discuss the oral cavity. Okay, so the oral cavity is a space between your lips, your cheeks. So eto, lips, then the cheeks, up to the anterior pillar of the fauces. Okay, so nasan ba si anterior pillar of the fauces? Yan. Okay, so wait lang. I'll just pull out my pen. So when a patient or you open your mouth, you will find two arches. Okay, so ito, ayaw po magsulat. Yan. So ito, yan, kasama niya si uvula. And then another arch here. Okay? This is what you call the anterior pillar of the fauces. Okay? That is the posterior boundary of the oral cavity. Okay? Posterior boundary of the oral cavity. Yan. So this is a boundary between the oral cavity and pharynx. Yan. So itong part na to, this is your tonsil. That's not part of the oral cavity already. That's part of your oropharynx. Yan. So sa oropharynx na yan. So hindi na natin yan. This is not already a part of the human anatomy that we could treat. Okay, so hanggang dito lang tayo sa anterior pillar of the fauces. Now, I always emphasize this, that whenever you are studying, okay, you have to know other terminologies. Okay? Kasi a structure may have one or two or more terms that relate to it. Okay? So, yung isang term, may mga other terminologies na pwedeng gamitin. And in the board exam, sometimes they use the less common term, yung hindi popular na terminology. So, you always have to know kung ano yung other term. So, for example, what is the other name for the anterior pillar of the fauces? Yan si anterior pillar. So, ano yung other name niya? It's called a fold. Okay, so what is that fold called? It's called your palatoglossal fold. Yes, very good. You could answer with me, huh? You could type your answers on our chat box. Yan. So I could see your answers. Yes, very good. This is called the palatoglossal fold. Why is it called the palatoglossal fold? Because underneath this is a muscle. Okay? May muscle dyan. Anong tawag nyo sa muscle na yon? You call that your palatoglossus. Okay? The palatoglossus is a muscle of the soft palate and the tongue, di ba? So it's a shared muscle between your soft palate and your tongue. Okay, so that's your anterior pillar of the fauces. It is the posterior boundary of the oral cavity. It is also known as your palatoglossal fold. Okay, because underneath it is a muscle. You call that your palatoglossus muscle. Okay, now syempre kung may anterior, yung posterior, alamin na rin natin, although it's not a part of the oral cavity. So what is the other name for the posterior pillar of the fauces? Kung palatoglossal fold yan, yung isa naman is palatopharyngeal. Yes, very good. Palatopharyngeal fold. Why? Because again, underneath this is a muscle. So anong muscle yon? Palatopharyngeus. Okay? Yan. Okay, so you already know the two pillars of the fauces. Okay, so anterior and posterior, or you have your palatoglossal fold and palatopharyngeal fold. You already know the muscles, palatoglossus and palatopharyngeus. Hindi kayo malilito ano yung mas anterior dun sa dalawang muscle or sa fold, because the tongue is anterior to the pharynx. Diba? Mas mauuna yung tongue ninyo bago yung pharynx. So si palatoglossus, yung anterior, si palatopharyngeus, yung posterior. Okay. So let us now discuss or answer number 1. So with that knowledge, you can now answer question number 1 in your final coaching material. Which of the following muscles form the lateral boundaries of the isthmus, yan, isthmus or pillar, yan, of the fauces? Yes. So palatoglossus, yan, tama yan. Okay, whenever you are answering questions, this is one of the test-taking strategies, diba? Pag tama yung isa, okay, continue ka sa isa, okay, tama. Now, if you want, so tama na to, okay, you already know that you have a correct answer. Pero baka may mali pa. So if you want to correct palatoglossus, but this is wrong. Palatoglossus, wrong. Palatopharyngeus, wrong. Palatoglossus, wrong. So the correct answer, yes, very good, is letter A, palatoglossus, which makes up the palatoglossal fold or anterior pillar, and palatopharyngeus, which makes up your palatopharyngeal fold or the posterior pillar. Okay, now the oral cavity has two parts. Okay, what are the two parts of the oral cavity? You have the vestibule. Okay, how do you define the vestibule? It is a space, diba? Between your cheeks, or the lips, and your teeth. Okay, that's your vestibule. And the other part of the oral cavity is the oral cavity proper. Okay, so ano naman si oral cavity proper? That is the part of the oral cavity internal to your teeth up to the palatoglossal fold. Okay, so those are the two parts of the oral cavity. Okay, so you have your vestibule and your oral cavity proper. Okay, now we already know the anterior boundary of the oral cavity, lips, di ba? We also know the posterior boundary, anterior pillar of the fauces. Now, how about lateral, superior, inferior boundaries of the oral cavity? Now, for the posterior boundary, we have the hard palate. Okay, so the hard palate is the anterior 2/3 of the entire palate. And so ito siya. This is your entire palate. This is your hard palate. So it makes up most of your palate, 2/3 of your entire palate. Now, the hard palate separates what two cavities? Okay, it separates the, syempre, oral cavity from what? What is the other cavity that is separated by your hard palate? This is your, yes, very good, your oral cavity, and this is your nasal cavity. Very good. Okay, that's why we say that the hard palate serves as the roof of the oral cavity kasi nasa top siya, and the floor of the nasal cavity. Okay, so the hard palate separates the oral cavity from the nasal cavity. Okay, so the oral cavity, the hard palate serves as the roof of the oral cavity and the floor of the nasal cavity. Okay, yeah, so roof of the oral cavity and floor of the nasal cavity. Okay, now your hard palate is made up of two bones, 1 and 2. So what are these two bones? You have your maxilla, and you have, yes, very good, yes, and you have the palatine bone. So C1, si maxilla, 2, si palatine bone. But what is this part? What is this part? Kasi ang maxilla, maraming parts yan. Ang palatine bone, marami rin siyang parts, right? So which specific part of the maxilla makes up the hard palate? Anong tawag nyo dito sa part ng maxilla na to? Kasi ito, part din yan ng maxilla, right? But this, you call this alveolar process. How about this? What part of the maxilla is that? Okay, that is your palatine shelves. Other name for palatine shelves, lateral palatine processes. Okay, lateral palatine processes. And how about this? Ano naman tong part ng palatine bone na to? Okay, what part of the palatine bone is that? That is your horizontal plates of the palatine bone. Okay, so specific, okay, specific part of the maxilla, the palatine shelves or the lateral palatine processes, and the palatine bone, okay, bones, horizontal plates. Okay, so those are the two bones. Now, yan, so yan si maxilla at si palatine bone. Now, What are the two sutures seen on the hard palate? So you also have two. What is a suture again? Okay, a suture will bind two bones together. Tama? Okay, sutures are found between two bones, binding them or uniting them together. Okay, sorry, mali yung isang arrow ko. Okay, palitan natin. Ito. Yan. So ano yung one at ano yung two? Okay, what is this suture called? Okay, you call that, so C1 ay, yes, very good, mid-palatine suture. Kasi it's between the two palatine shelves or the two lateral palatine processes. Tama? Okay, uniting the two processes of the maxilla. Other name for the mid-palatine suture. Other name. It's also called the yes, very good. Intermaxillary suture. Okay. Now, how about this? Number 2. Anong tawag niyo dyan? Okay, sa number 2. Between the maxilla and the palatine bone. Yes, very good. Number 2 is your transverse suture or the transverse palatine suture. Okay? Pero mas common na ginagamit to, si transverse suture. Alright? Okay, so you have the two sutures joining the bones of the palate, hard palate. You have the mid-palatine or the intermaxillary suture between the two palatine shelves. And you have the transverse suture between the maxilla and the palatine bone. Okay, now, what else can we find in hard palate? You have the three foramina. Okay, 1, 2, 3. So ano to? Anong foramina ito? Si number 1. What is that foramina called? That's your, very good, incisive foramen. Okay? So si incisive foramen serves as what? Okay, it serves as an exit, kasi ang foramen, it's an exit of structures like blood vessels, okay, and nerves, okay, from the skull. Okay, so yes, very good. The incisive foramen is for the nasopalatine nerve. Okay, so we will be discussing the nasopalatine nerve in the cranial nerves. Okay, and how about number 2? Ano yan? Anong foramen yan? Si number 2. Very good. That's your greater palatine foramen, which serves as an exit for the greater palatine nerve and blood vessels. Kung may greater, ano naman to? Si lesser palatine. Very good. Okay, lesser palatine foramen. Okay. And kasi it is it's the pathway or exit for the lesser palatine nerve and blood vessels. Okay, so those are the three foramina seen on the hard palate. Next, the soft palate. This is the wait lang. Okay, mali yung sinabi ko kanina sa hard palate. Balikan ko lang ha. Okay, superior boundary to. Antero actually. Antero superior boundary. Okay? Antero superior boundary. Sorry. Okay, nagkamali lang. And then yung soft palate naman, yung postero superior boundary. Okay? So postero superior boundary. If your hard palate separates the oral cavity from your nasal cavity, how about the soft palate? So it separates, syempre, oral cavity from what? What cavity? Yes, very good. And your nasopharynx. Very good. Okay? So the oral cavity is separated from the nasopharynx by your soft palate. Okay, so The soft palate is purely made of muscles. Can you name me the muscles making up the soft palate? You have 5 pairs of them. What are the muscles making up the soft palate? Okay, you have tensor veli palatini. Yes, very good. Okay, then you also have levator veli palatini. Okay, ano pa? Kanina, yung sinabi natin, palatoglossus, di ba? So, yes, you have your musculus uvulae. Okay, and yung isa is palatopharyngeus. Yes, very good. Okay, so these are the 5 muscles making up the soft palate. Now, syempre kapag may muscle, may innervation. What nerve will innervate the muscles of the soft palate? What nerve? To. Okay, you know the innervation? It's your pharyngeal plexus. Okay? Except for one. May isa dyan na hindi ini-innervate ng pharyngeal plexus except your tensor veli palatini. So itong 4, pharyngeal plexus, pero si tensor veli palatini, what do you think? Innervates sa tensor veli palatini. Very good. Cranial nerve number 5. Okay? Because just like sa histo, malalaman natin na ang tensor veli palatini galing din sa pharyngeal arch number 1. Okay? So those are the 5 muscles of the soft palate. Tensor veli and levator veli palatini. Then you have your palatoglossus and palatopharyngeus and your musculus uvulae. Okay? Now, what is a pharyngeal plexus? Kasi tinatanong din si pharyngeal plexus. Is it motor, sensory, or mixed nerve? Mixed, yes. This is a mixed nerve. What cranial nerves will provide branches to create the pharyngeal plexus? Very good. The pharyngeal plexus is named as such because it is made up by pharyngeal branches coming from cranial nerves number 9, 10, 11. So si cranial nerve number 9, may pharyngeal branch. Si cranial nerve number 10, may pharyngeal branch din. And si 11, may pharyngeal branch din. These 3 will unite to form the pharyngeal plexus. Now, why is it mixed? Because some of the pharyngeal branches are motor and one is sensory. Ano dyan yung sensory branch? Anong pharyngeal branch ang sensory? 9, very good. To si sensory. Si 10 at 11 ay motor. Okay? Kaya nga, kapag wala kayong makitang pharyngeal plexus, so baka sabi ni Doc, ang innervation nito, pharyngeal plexus, pero wala namang pharyngeal plexus dito. Ano ang pwede ninyong hanapin from the choices? You look for cranial nerve number 10. Yes, very good. The vagus nerve. So if you know that a structure is innervated by the pharyngeal plexus and you cannot find the pharyngeal plexus on the choices, look for the vagus nerve, cranial nerve number 10. So you might ask, bakit hindi Doc 11? Because 11 is just an accessory. Yan. It is a supporting nerve lang to your vagus nerve. Okay, so it only gives a minor contribution to the motor division of the pharyngeal plexus. Okay, so that's your pharyngeal plexus. There was a time, okay, sobrang ang daming questions sa pharyngeal plexus. Yan, lumabas lahat yan. Yan, o di ba? Okay, sayang naman kung lumabas siya ulit tapos hindi natin alam yung mga sensory and motor branches niya. Okay, di ba? So, okay, now, okay, you know. So if ever that it comes out again in the board exam, you could answer it with all confidence. Okay? So let's take a look at your muscles. So the tensor veli palatini originates from the cartilage of the auditory tube and the scaphoid fossa. Okay, so ang scaphoid fossa andito sa part na yan. Ito si tensor veli palatini. Insertion is the palatine aponeurosis. Ito si palatine aponeurosis. What is an aponeurosis, class? Kasi lumabas na rin yan sa board exam. What is an aponeurosis? It is similar to a tendon or a ligament. Yes, very good. It is a tendon sheet. What is the function of a tendon? Very good. It's a flat, it is wide tendon sheet. So ano ang function ba ng tendon? A tendon will connect a muscle, okay, to a bone. Pag tendon ha, muscle to bone. Now, if it's an aponeurosis, this will connect one muscle to another muscle. Okay, so that's specific function of an aponeurosis. Kung tendon, it will connect a muscle to a bone, while an aponeurosis will connect one muscle to another muscle. How about a ligament? What's the function of a ligament? It connects, yes, very good, a bone to another bone. Okay, so the action of the tensor veli palatini is to pull the soft palate laterally, okay, creating tension on the muscle. Okay, so again, tendon will connect muscle to bones, ligament, one bone to another bone, and muscle, and aponeurosis, one muscle to another muscle. Okay, so the tensor veli palatini hooks around the, okay, ano to? Ayan, meron ng pangalan, hamulus. Yes, okay. This is a muscle of the soft palate that is found to be hooked around a bony process you call your hamulus. Okay, now the other muscle is levator veli palatini. Okay, so as the name implies, veli palatini means soft palate. And so it elevates, okay, the soft palate. So the origin is the cartilage of the auditory tube and the temporal bone. Insertion is the palatine aponeurosis and muscle of the opposite side. So ito. Actions, again, it will elevate the soft palate and pull the soft palate posteriorly. So posteriorly, helping close the nasopharynx. You have to understand that soft palate muscles collectively close off the nasopharynx during deglutition. Whenever we swallow, kasi may opening, class, there is an opening or a communication between your oral cavity and your nasopharynx. May butas yan. Okay? So, kailangan ma-close yung butas every time we drink, every time we swallow our food. Kasi kung open, lahat ng kinakain natin pupunta sa nasopharynx. Okay? Diba sometimes, I don't know if may someone na hindi pa nakaranas nito, but there are times, lalo na pag nag-uusap tayo when eating, nagtatawanan, some of the water or anything, any drink, okay, napupunta sa nasal cavity natin, 'di ba? So, magtataka ka paano napunta doon, okay? 'Di ba? Kasi nga there is a communication between your soft palate, your oral cavity and the nasopharynx. So, it is closed off. It does not usually happen that whenever we swallow, pumupunta sa ilong. Okay? Kasi nga the muscles of the soft palate will close off that opening during deglutition. Okay, so lahat yan, they contribute to that. Okay, musculus uvulae. Okay, so this is, ang liit-liit lang ng uvula, but it is purely made of muscles, right? So the origin is the posterior nasal spine, and the insertion is the mucous membrane of the uvula. Okay, and the actions are to elevate the uvula, okay, and to pull the uvula laterally. So it elevates, so it's a levator and a tensor of the uvula only, okay, not the entire soft palate. And then we have the palatopharyngeus muscle. So kanina na-discuss natin yung posterior pillar of the fauces. Okay, so this is the muscle that's underneath it. Okay, kaya nga it's called the palatopharyngeal fold. So the origin is palato. Yes, okay, I'll be sending you a copy of the lecture later. Okay? I'll be sending a copy of this. Kaya kung ano yung nandito sa slide, you don't need to write them down. You just write down everything that's not here. Okay? Or kapag hindi na right, you could listen to the recording. Kasi I think they will be sending you a recording. Diba? But I will be giving this to you, so you don't need to copy it, don't need to take pictures of it kasi I'll be sending a copy. Okay? Yan. Nakalimutan ko lang kasi kagabi. Yan, kanina I'm checking, hindi ko talaga siya nagawa. Yan. So, palatopharyngeus. So, you know the origin. May mga muscles kasi, class, na yung origin at insertion nakastipulate dun sa name nila. Like ito, palato. So, ang origin niya is your palate. So, the posterior border of the hard palate and the palatine aponeurosis. Pero, medyo misnomer yung pharynx kasi pharyngeus. Kasi the insertion is not the pharynx. Instead, the insertion is the posterior border of the thyroid cartilage. Okay? Ewan ko ba bakit nila pinangalanan na palatopharyngeus. Sana palatothyroid na lang para naman mas madali, di ba? But then, okay, it's called palatopharyngeus. Okay, so just take note of the insertion. It's on the thyroid cartilage. Okay, so the actions are to elevate the pharynx and larynx, and this is the main muscle that will close off your nasopharynx. Okay? Diba? Sabi ko kanina, your soft palate muscles will close off the communication between the oral cavity and the nasopharynx. Ngayon, kung may question na gano'n, tapos nakalist down lahat soft palate muscle, sabi ni Doc, lahat ng soft palate muscles will close off the opening. Pero lahat to soft palate muscle. So anong i-answer ko? The main muscle that closes off that opening is your palatopharyngeus muscle. Okay? And finally, a while ago again, we discussed your anterior pillar of the fauces or the palatoglossal fold. Okay, so the muscle underneath it is your palatoglossus. Okay, so again, okay, the origin is the palate. Okay, so palatine aponeurosis, and the insertion is the tongue, side of the tongue. Okay, the palatoglossus muscle, once we discuss the tongue, makikita nyo ulit to. It's the same muscle. Okay, hindi magkaibang muscle yon. Okay, it's the same muscle, so muscle is being shared by your soft palate and your tongue. Okay, ganun din actually si palatopharyngeus. It is also considered a muscle of the pharynx. Yan. Okay, so palatoglossus, the actions are to elevate the tongue and narrow the oropharyngeal isthmus for deglutition. Okay. Yan. So, ayan yung kanyang insertion, tapos origin at insertion. Okay. So, kanina na-discuss na natin to. What innervates the muscles of the soft palate? Pharyngeal, plexus. Ano ulit yung exception? What's the exception? Except tensor veli palatini. Yes, because tensor veli palatini, okay, is innervated by cranial nerve number 5. Okay, so again, the pharyngeal plexus is a mixed nerve. It is made up by the pharyngeal plexus, pharyngeal branches of cranial nerves number 9, 10, 11. So 9 is the sensory division, 10 and 11 is the motor division. Okay, again, if you are very confident that the innervation for this muscle is the pharyngeal plexus and you cannot find pharyngeal plexus on the choices, basta motor, kapag mga muscles, motor nerve dapat ang hanapin nyo. So for motor innervation, that's cranial nerve number 10 or the vagus nerve. Kung sensory, syempre 9. Ha? Kunwari, sensory innervation to the to your palatopharyngeus. Okay, pag sensory, 9 naman yun. Pero pag motor, causing it to contract, okay, that's your vagus nerve. Okay. Now, number 2. Which of the following are 2 muscles that prevent food from entering the nasopharynx during swallowing? So you know that muscles of the soft palate act to close off the nasopharynx during swallowing. So tingnan natin, ano ba dito ang muscle of the soft palate? Mylohyoid? No. Bakit? Ano ba si mylohyoid? It is a suprahyoid muscle. Okay? So kapag ganyan, class, wag mo nang basahin yung susunod. Okay? Wag mo na itong basahin kasi that's just wasting your time. If yung umpisa mali, mali na yung entire option na yan. Styloglossus, ay wala rin. Kasi this is a muscle of the tongue. Tensor tympani, okay, this is a muscle of the ear, middle ear. Okay, tensor veli palatini, okay. Then levator veli palatini, yes. Okay, let's again check the option. Musculus uvulae, but inferior pharyngeal constrictor. So the correct answer is letter D. Tensor veli palatini and levator veli palatini. Now, number 3, each of the following statements is correct regarding the levator veli palatini except one. Which one is the exception? O, tingnan natin. It is an extrinsic muscle of the soft palate. Okay, anong ibig sabihin pag extrinsic? The origin, okay, is outside the soft palate, while the outside soft palate, the insertion is in the soft palate. Kaya anong insertion nito? Palatine aponeurosis, tama? And okay, the muscle on the opposite side. So this is correct. It elevates the soft palate. Yes. It is innervated by the vagus nerve. Yes. It inserts into the palatine aponeurosis. Yes. It hooks under the hamulus. No. Why? What is this muscle? What muscle is hooked under the hamulus? Yes, very good. This is your tensor veli palatini. Di ba? Okay, so number 3, the correct answer is letter E. Okay, now lateral boundaries of your oral cavity, cheeks. Yeah, so this extends anteriorly from the labial commissure, posteriorly to the ramus of the mandible. Okay, so yan yung cheeks natin. Now, number 3 is E. Okay, it hooks under the hamulus. Okay, so what muscle is found on the cheek? Kasi wala tong bone, okay, but it has muscle. What muscle forms, okay, the support of your cheek? Anong muscle? Kapag cheek ang pinag-usapan, what muscle can be found on the cheek? That's your buccinator. Yes, okay. Buccinator is a muscle of facial expression, okay, that helps in mastication. Okay, so that's buccinator. Then, inferior boundary of the oral cavity, you have the floor of the oral cavity or the floor of the mouth. Okay, it's a horseshoe-shaped region. Yan. Okay, located along the lingual border of the mandible. Okay, yan. Okay, so horseshoe-shaped region. Now, what are the muscles making up the floor of the oral cavity? You have 2. Can you name me the 2 muscles that you could find on the floor of the oral cavity? Yes, very good. You have the mylohyoid muscle. And what's the other one? Yes, geniohyoid muscle. Okay, so the mylohyoid muscle is innervated by what nerve? Anong innervation nito? Cranial nerve number 5. Very good. How about the geniohyoid muscle? What's the innervation? Very good. Spinal nerve, cervical spinal nerve number 1. Both of these muscles are suprahyoid muscle. Now, if it's a suprahyoid muscle, what is their main action? Ano ang main action ng mga suprahyoid muscles natin? They elevate the hyoid. Hyoid. Okay? So they elevate the hyoid bone because they are connected to your hyoid bone. Okay? So they elevate the hyoid. But the mylohyoid has another action aside from elevating the hyoid. Ano pa ang other action ng mylohyoid? It's to elevate what? Elevate the, yes, the floor of the mouth. Yes, or the floor of the oral cavity. Okay, so again, lahat ng suprahyoid muscle will elevate the hyoid bone. Okay? But the mylohyoid muscle can also elevate the floor of the mouth. Okay? Or the floor of the oral cavity. Okay, so we're done with the oral cavity. Now let's discuss your dentition. Okay? So let's start with tooth terms. Yan, tooth terminology tayo. So a tooth will always have two parts. Okay? So yung mga specific parts, okay, those are specific characteristics of a tooth, but generally, a tooth can be divided into two. You have the crown and you have the root. Okay, now, there are two types of crowns. Tama? There are two types of crowns. What are the two types of crowns? Two types of crowns. You have an anatomic crown, yes, and a clinical crown. Okay. Now, how do you differentiate between the two? So, anatomic crown, ang anatomic crown natin, ano yan? From CEJ to incisal edge or occlusal surface. Okay? While the clinical crown is from gingival margin, okay, to incisal edge or occlusal surface. That's the difference, okay, between an anatomic crown and a clinical crown. The basis, occlusally or incisally, would be the surface. But cervically, pag anatomic, ang landmark nyo, CEJ. Pag gingival, pag clinical crown naman, the gingival margin. Now, on what type of crown can you find enamel only? Enamel only is found on anatomic or clinical crown. Ano dyan? Anatomic. So si anatomic, enamel only. Hindi pwedeng magkaroon ng cementum dyan. Okay? But in a clinical crown, you can have either enamel only or enamel and cementum. In cases where there is a cervical, a gingival recession. Okay? Kasi everything that you see in the mouth, all you see in the mouth is called your clinical crown. Pag open ng patient ninyo, ng bibig niya, lahat ng nakikita nyo dyan, kahit sabihin nyo pa, root na po yan, doc, that's still the clinical crown. Lahat ng nakikita above the gingival margin is called the clinical crown. Kaya pwedeng magkaroon ng cementum ang clinical crown. But when you call it anatomic crown, hindi pwedeng magkaroon ng cementum dyan. It's just that part of the tooth covered by enamel only. So let's answer number 4. The anatomic crown is that portion of a tooth that is in occlusion. In occlusion ba? No. in occlusion are the marginal ridges, the central fossa, okay, of your teeth, exposed to oral fluids, okay, coronal to the cervical line, okay, or occlusal to the gingival margins. Anatomic, yes, it's coronal to the cervical line. Kapag occlusal to the gingival margin, this is your clinical crown. Tama? Okay. So anatomic crown, again, it extends from the CEJ, CEJ up to the incisal or occlusal surface. Okay. So enamel only. Clinical crown extends from the gingival margin. O, tingnan nyo to, may recession. Clinical crown pa rin yan. Okay, up to the occlusal surface or the incisal edge. Okay, kaya ang clinical crown, you can have cementum, and enamel, or enamel and cement, enamel only. Okay, so the correct answer for number 4 again is letter C. So root, this is firmly fixed in the bony process of the jaw. What is that bony process called? What do you call that specific bony process that anchors the roots of your teeth? Tawag niyo dyan. Tawag niyo doon. O, dito, anong tawag niyo dyan? Yes, very good. Alveolar process. Okay, so we'll discuss the components of the alveolar process in histo. And it contains the pulp canal. Okay, so these are the canal configurations kasi lumabas na rin to in previous exam. So yung exam right after the pandemic, merong question nito. Type 1 is called 1-1. Itong number na to will describe to you the number of canals from pulp chamber to apical foramen. Okay? So pag sinabing 1-1, from the pulp chamber, isa, and then nag-exit, isa pa rin. So 1-1. Type 2 is 2-1. Kasi from the pulp chamber, you have 2, 1, 2, then nag-unite siya before it ends at the apical foramen, kaya 1. Diba? 2, 1. Ang type 3 naman, 2-2. From the pulp chamber, dalawa, nag-exit din na dalawa sa apical foramen. And type 4, 1-2 kasi 1 from the pulp chamber to, nag-exit sa apical foramen. Okay, so those are the different types of pulp canal. So type 1 is 1-1, type 2 is 2-1, type 3 is 2-2, and type 4 is 1-2. Okay, di ba? So hindi nyo na kailangan kabisaduhin 1 from the pulp chamber, 1 in the apical foramen, 2 in the pulp chamber, 1 in the apical foramen. Okay, ito lang, 1-1. So type 1 is 1-1, type 2 is 2-1, type 3 is 2-2, type 4 is 1-2. Okay? Although marami na tong naging they have already modified this. Meron ngang 8 classifications na yung iba. Pero sa board exam, ito yung lumabas. Yung basic types ng pulp canal morphology. Okay, now tooth surfaces, you're already familiar with this. When you say facial, this refers to the labial of your anteriors and the buccal of your posteriors. And then occlusal surface for the posteriors from premolars to molars. There is no such thing as an incisal surface. We only have an incisal edge or an incisal ridge. Okay. Proximal, this is your mesial and your distal. And lingual, which we also call palatal for the maxillary arch. Okay, maxillary teeth. Okay, so labial, it faces your lips, buccal faces your cheeks. Mesial is near the midline, distal is farther from the midline. Palatal or lingual facing the palate or the tongue. Okay, so ito yung mesial, ito yung distal, ng canine. Okay, and then your lingual. Okay, number 5. Which of the following surfaces of a tooth is always next to an adjacent tooth? Distal, So, pwede. Always next daw eh. Pero, hindi naman kasi distal ang katapat niya mesial, di ba? Facial, wala namang adjacent sa facial. Palatal, wala rin. Occlusal, lalo na. Yes, proximal surfaces are always next to an adjacent to. Okay, so number 5, the correct answer is proximal. Okay, so, usually, it's distal to mesial. Tama? Distal to mesial. Now, what teeth have their mesial surfaces connected together with mesial? So, mesial ng one tooth at mesial ng another tooth. Mesial surfaces in contact. Yes, very good. Your central incisors, maxillary, and mandibular. They are the only teeth in the oral cavity where the mesial surfaces are in contact. So mesial to mesial. Lahat na distal to mesial, distal to mesial. Okay, so number 5 again, the correct answer is letter E. Okay, now let's go to tooth landmarks. Okay, so these are the elevations that you find on teeth. You have a lobe, you have a mamelon, you have a cusp, tubercle, cingulum, and the different ridges. So let's discuss these elevations. So lobes are the growth centers of the tooth. They are the primary centers of calcification and formation in the development of the crown. Okay, so to summarize the number of lobes, you have to remember, class, that a tooth will develop from a minimum of 4 lobes. Yeah, minimum 4 lobes. Okay, so anteriors, 3 labial, 1 lingual. What happens to your labial lobes? Labial lobes will become your mamelons. Okay, while the lingual lobe will become the cingulum. Okay, premolars, 3 buccal, 1 lingual. The 3 buccal will become 1 buccal cusp. Okay, and the lingual will become 1 lingual cusp. But there is an exception. Okay, except your mandibular mandibular is second premolar. Why? The mandibular second premolar, or some or most of your mandibular second premolar has 3 lobes. So it will develop from 3 buccal and 2 lingual lobes. Okay? If it is a 3 cusp mandibular second premolar. Okay, now maxillary first molar 4, but if the cusp of Carabelli is present, then it will develop from 5 lobes. Okay, mandibular 5, second molars in both arches 4, and third molars again at least 4. Okay, now mamelons, they are rounded protuberances found on the incisal edges of newly erupted incisors. Mamelons always develop in groups of 3. Okay, why? Because they came from your 3 labial lobes. Kaya laging tatlo yan. So they are made of pure enamel. Okay, that's why they are translucent with no dentine underneath. Next, number 6. The presence of mamelons on a 19-year-old patient suggests which of the following conditions? Is it normal for you to find mamelons on a 19-year-old patient? No. Why? Because mamelons are affected by the process of, okay, anong process? Yung wearing away of your teeth. Whenever your teeth function, whenever they contact, you have loss of tooth structure. Yes, you call it attrition. O yan, para di malilito. Attrition is physiologic, wearing away of your teeth. So these are the wearing away of tooth structure, or loss of tooth structure. Attrition is physiologic, brought about by occlusion, normal function. Okay, attrition. How about
chemical wearing away of your teeth. Ano yun? Chemical. Mare, mahilig kayong mag-sip ng lemon. Yes, that's erosion. How about mechanical wearing away of your tooth? Yes, toothbrushing, horizontal. Yes, that's your abrasion. This is your chemical. Because of tooth flexion, anong type ng wear yun? Abfraction. Yes, very good. Abfraction is due to tooth flexion. Okay, now, sabi natin, hindi normal kaya na magkaroon ng mamelons ang 19-year-old kasi nga it's affected by the process of mastication. Okay? So, kung meron pa sa 19-year-old, meaning to say there's no contact. Okay? Hindi nagka-touch yung teeth. So, ano dito? Yung condition that will not lead to touching of the teeth. Fluorosis? There. So, problem with occlusion. Malformation? Hindi rin. Malnutrition? Hindi rin. Delayed eruption? No. Okay? It's anterior open bite. Nakagaya siya. Okay? Ano bang nangyayari, class? Bakit nagkaroon ng anterior open bite? Why is it that you have an anterior open bite? What's the reason for anterior open bite? Because of supra-eruption of your posteriors. Okay, so you brought about the reasons. Okay, anterior open bite. Bakit nagkaka-anterior open bite? Kasi nag-supra-erupt yung posteriors. Kaya pagkagat, occlude, hindi na makapag-occlude yung anteriors kasi nag-occlude na yung posteriors. Now, so anterior open bite is brought about by supra-eruption of posteriors. Okay? Yan. Now, ano yung what are the things or the habits that could lead to this? Tama kayo. Thumb sucking. Yan. Thumb sucking. Ganyan, oh. Okay? Nag-thumb suck si baby. Anong nangyayari? Yung anteriors natin, lalo na kung long duration, yan. Long duration, yung posteriors natin, magsusupra-erupt yan kasi they will find their contact, diba? Their occlusion, kaya magsusupra-erupt. So there will come a time na hindi na magko-contact yung anteriors because of supra-eruption of posteriors. Yes, mouth breathing, okay, can also lead to anterior open bite. Okay, because again of the same process. Kasi magsusupra-erupt yung ating posterior teeth. Okay, so that's your anterior open bite. Okay, anong tawag natin? How do we describe patients with anterior open bite? Long face syndrome, di ba? Okay, kasi nga, mas mahaba na yung lower third ng face nila kasi nga naka-open. Okay, so that's anterior open bite or the long face syndrome. Okay, so number 6, the correct answer is letter E. Another elevation on the tooth cusp, it's an elevation or mound on the crown portion of a tooth, making up a divisional part of the occlusal surface. So cusps are from your lobes. Lobes in posterior teeth will become your cusp. Okay. Tubercle, this is a smaller elevation on some portion of the crown, manifesting as a supernumerary cusp. Okay, what is an example of tubercle that could be normally found on a tooth? Normal. Yes, the cusp of Carabelli, which you find on what teeth? What tooth? Maxillary first molar. What cusp? Nasa ang cusp of Carabelli. On what cusp can you find it? Yes, on the mesiolingual cusp of the maxillary first molar. Is it always present? A cusp of Carabelli? No. Okay, very good. It may or may not be found on a maxillary first molar, but if it's present, kung meron man, it will only be found on a maxillary first molar. Okay? And cingulum, ang cingulum, it's also from the lingual lobe of your anteriors. So it is a mesiodistal convexity encircling the lingual cervical third of your anterior teeth. Okay, this makes up the bulk of the cervical third of the lingual surface. Now, question, do all anteriors have a cingulum? Meron ba lahat ng anterior teeth cingulum? Yes. So, kung tatanungin kayo, ilang cingulum meron sa oral cavity, human oral cavity? Ilan lahat? Very good. You have 12 all in all. Now, baka akala natin wala kaysa mandibular anteriors because they are not prominent, but they are still present. Okay? So this is true for both primary and permanent. You have cingulum in all anteriors. You have 12 in both primary and permanent dentition. Okay. Now, not all cingulum are centrally located. Okay, so what anterior teeth would have a centrally located cingulum? Nasa gitna. Okay, anong ngipin yon? You have your maxillary, lateral incisor, and canine, and your mandibular central incisor. Okay? So yung off-centered na, alam nyo na yon. Kasi kung alam nyo to, alam nyo na rin yung off-centered. So you have the maxillary, central incisor, and your mandibular, lateral, and canine. Off-centered towards what? Towards the distal or towards the mesial? Saan siya naka-direct? Yes, towards the distal. So it is inclined towards the distal. Again, centrally located cingulum include your maxillary, lateral, and canine, and your mandibular central incisor. Pag off-centered naman, maxillary, central, and then mandibular, lateral, and canine. Okay. So ridge. These are linear elevations on the surface of a tooth. Okay, so what are the different ridges? Lingual ridge, labial ridge, buccal or cusp ridge, cervical ridge, marginal ridge, triangular ridge, transverse ridge, and oblique ridge. Okay, now, lingual ridge. Anong anterior ang merong lingual ridge? So in anteriors, ano yan? Yes, canines. Both maxillary and mandibular. Okay? Now, it is more prominent on your maxillary than on your mandibular canine. Ang posteriors, anong teeth ang merong lingual ridge? Meron din sa posteriors. Premolars. Okay, but it is more prominent on the first than on the second. You could find both lingual ridges on, you could find lingual ridge on both maxillary premolars and mandibular premolars, first and second. And again, it's more prominent on the first than on the second. Okay, labial ridge. Okay, so ang lingual ridge, it runs cervico-incisally or cervico-occlusally. Yan. How about a labial ridge? Saan natin makikita ang labial ridge? The term labial tells you that it is on an anterior tooth. So yes, it is also on canines. Okay? Also cervically to incisally. Okay? So that's a labial ridge. Again, it is more prominent on a maxillary canine than on a mandibular canine. Then you have the buccal ridge. Ano namang ngipin ang may buccal ridge? What teeth would have buccal ridges? Premolars. Maxillary, mandibular, first and second. Lahat ng premolars meron. But it is more prominent on the first than on the second premolar. It's like a labial ridge. It runs cervico-occlusally. Okay, so that's a buccal ridge. Cervical ridge. Saan natin makikita ang cervical ridge? What teeth would have a cervical ridge? All anterior teeth. All primary teeth. Hindi na erase. All primary teeth, anteriors and posteriors, buccally. Okay, so nasa buccal siya. And permanent molars only. Okay, so they are the only teeth with a cervical ridge. So this runs mesiodistally on the facial surface of primary teeth, all primary teeth, and the buccal surfaces of your permanent molars. Okay, so that's a cervical ridge. It's called a cervical ridge because it's found on the cervical third of the tooth. Marginal ridge. What tooth or what teeth have marginal ridges? Saang ngipin kayo makakakita ng marginal ridge? Very good. All teeth. Maxillary, mandibular, anteriors, posteriors. So nasaan yung location ng marginal ridge sa anteriors? Lingual surface. While on posterior, you could find it on the occlusal surface. Tama? Mesially at distally. So meron tayong mesial at distal marginal ridge. Now, question. What tooth has the most developed marginal ridge? Anong ngipin ang may pinaka-developed na marginal ridge? Very good. Your maxillary lateral incisor. The maxillary lateral incisor has the most developed lingual anatomy. So lahat ng nasa lingual surface niya, very pronounced or prominent. Most prominent lingual anatomy. So it has the most developed marginal ridges. Okay, now, how do you determine the level of marginal ridges on teeth? Ano yung magkaka-level dapat? Okay, for example, you are doing a class 2 cavity preparation. How are you going to restore the level of your marginal ridges? What is your basis for restoring the proper level of your marginal ridges? When it comes to level, your basis would be adjacent marginal ridge. Okay, yes, adjacent marginal ridges. For example, you have prepared class 2 disto-occlusal cavity preparation, okay, on a maxillary first premolar. How are you going to restore the distal marginal ridge level? What are you going to use? The mesial marginal ridge of the maxillary second premolar. Because these two, okay, are adjacent. Tama? So they are at the same level. Very good. Okay, so how do you determine the level? Okay, adjacent marginal ridges are at the same level. Okay, next. So occlusocervically, the height of the mesial marginal ridge, height ng mesial marginal ridge of a permanent mandibular first molar is the same as the height of the, so mesial to, ang katabi niya, distal marginal ridge. Tama? Ng anong tooth? Mandibular, second premolar. Tama? Triangular ridge, no? Triangular ridge, no? Distal marginal ridge, pero first molar. So hindi. They are not at the same level. Always remember, class, that on posterior teeth, marginal ridges are not on the same level. Mamaya pag-usapan natin yon. Mesial marginal ridge of a mandibular second molar, hindi rin. Okay? Ang layo na nun, di ba? Nasa kabilang ngipin na yon. Distal marginal ridge of the second premolar, yes. So the correct answer for number 7 is letter E. Now, on posterior teeth, which is more cervically located? The mesial marginal ridge or the distal marginal ridge? Yeah, sabi ko nga, on posteriors, marginal ridges are not at the same level. Not on the same level. Yung isa mas mababa, okay? If you're going to use yung mga layman's term, yung isa mas mababa, yung isa mas mataas. Ganun yun. Okay? But we, of course, medical terminology, we describe it as more coronal, mas mataas, more cervical, mas mababa. Ibig sabihin. Okay? So ano dyan yung mas cervical? Okay, yung mas mababa. Is it the mesial or the distal marginal ridge? Yes, very good. The distal marginal ridge is more cervical than the mesial marginal ridge. But there is an exemption. Except for what? Anong ngipin ang hindi nagfo-follow ng rule na to? What tooth? Mandibular. First premolar. Why? The mandibular first premolar has a more cervical mesial marginal ridge than distal marginal ridge. Okay? So again, more cervical ang distal marginal ridge on all posteriors except for the mandibular first premolar na ang more cervical mesial marginal ridge. Okay, let's answer another question. Which of the following premolars has a mesial marginal ridge that is more cervically located than its distal marginal ridge? Ano ulit yung answer natin? Ano ba dapat? Ang mesial marginal ridge ang more coronal. Hindi siya cervical dapat. Ang distal marginal ridge ang more cervical. But there is a tooth that does not follow that. And that's your, yes, mandibular first premolar. Letter C. Okay, another question. So on posteriors yun. On anteriors, which is longer? Okay, mesial marginal ridge or distal marginal ridge? Ano dyan ang mas mahaba? Very good. Mesial marginal ridge. Except for what again? There is an exception. Except for, kasi equal siya. Ano naman yung exception dyan? Except kasi ang marginal ridges niya, equal. Same length. Anong tooth yan? Anong anterior tooth yan? Ano yung sabi natin? Bilaterally symmetrical? What tooth is that? Yes, very good. Your mandibular central incisor. Okay, but all the rest of your anteriors would have a longer mesial marginal ridge than distal marginal ridge. Okay, another ridge, triangular ridge called as such because the slopes resemble a triangle. Yan, mga slopes niya. So they descend from cusp tips toward the central part of the occlusal surface. Their slopes resemble the sides of a triangle. And you could find them on posterior teeth. Okay? Yan. So posterior teeth. Now, transverse ridge, okay, is the union of two ridges. What ridge unite to form a transverse ridge? Triangular ridges. So when two triangular ridges unite, you form a transverse ridge. So since nag-unite silang dalawa, this ridge will now cross the occlusal surface of most posterior teeth bacolingually. Okay? So a transverse ridge could be found on molars and premolars. So on molars between, okay, disto lingual and distobuccal cusp. Yan. Okay, and between your mesiolingual and mesiobuccal cusp. Yan. Okay, and on premolars between your buccal and your lingual cusp. Okay, so that's your transverse ridge. You could find them on premolars and molars. Okay, now, oblique ridge runs obliquely, okay, diagonal, okay, across the occlusal surface. What two ridges unite to form an oblique ridge? Anong ridge to? Okay, at anong ridge to? Okay, you have two cusps. So an oblique ridge is found between two cusps. Anong cusp yun? This is your mesolingual cusp. Yes, very good. And distobuccal. Okay, mali. Okay, bucodistal. Okay, distobuccal. Now, anong part to ng mesolingual cusp? Sa mesolingual cusp, you call that distal cusp ridge. Okay, on your distobuccal cusp, that's your triangular ridge. Yes. So these two ridges, the distal cusp ridge of the mesolingual cusp and the triangular ridge of the distobuccal cusp will unite to form an oblique ridge. It's found on what teeth? What teeth would have an oblique ridge? Maxillary, molars. Lahat ba ng maxillary molars may oblique ridge? Lahat? No. Maxillary, first and second only. Permanent and primary. Yan, meron silang oblique ridge. Okay, so that's your oblique ridge. Now, 8. On molar, depressions immediately distal to the mesial marginal ridge. So depressions naman, kanina elevations, di ba? And immediately mesial to the distal marginal ridges are triangular fossa, central fossa, interdental spaces, proximal concavities or spillways. Okay, so let's now discuss your depressions. So this will include sulcus, fossa, developmental groove, pits, and supplemental grooves. Okay, so a sulcus is a long depression or valley between ridges and cusps. Yan. So kung ito, okay, ito from the lateral view. Okay, ihalintulad natin sa mountains yung ating mga cusps. So you're looking at it from the lateral view. So merong ganyan, merong ganyan. Okay. Itong entire thing na to, yung depression na yan ang sulcus. Now, kung saan nag-meet yung dalawang slope, itong part na to, yan ang groove. Okay? So ito lang. Okay? Kung saan nag-meet yung dalawang slope, yan ang groove natin. Pero this entire depression here, you call that the sulcus. So a sulcus is different from a groove. Lingual fossa, okay, so this is found on the lingual surface of incisors, maxillary, mandibular. Question, do canines have a lingual fossa? Yes or no? May lingual fossa ba ang canines? Yes, but how is the lingual fossa of a canine different from the lingual fossa of an incisor? Yes, very good. It's divided into two. You have a mesial lingual fossa and a distal lingual fossa. Bakit kaya nagkaroon ng dalawang lingual fossa ang canines? Dahil meron silang what? Because of what divided the lingual fossa of a canine into two? Your lingual ridge. Diba? Meron siyang ridge sa gitna. Kaya nag-divide yung lingual fossa niya into two. But nevertheless, it has a lingual fossa. Central fossa, this is on the occlusal surface of molars. It's formed by the convergence of ridges terminating at a central point. Okay. Now, what premolar? So, sabi natin nasa molars lang siya. Pero, there is a premolar with a central fossa. Anong premolar ang may central fossa? Yes, very good. Mandibular, second premolar, lahat ng klase ng mandibular second premolar, Y-type only. Yes, yung H at yung U, wala rin silang central fossa. Triangular fossa, ito naman. They are found on the occlusal of molars and premolars. They are mesial or distal to your marginal ridges. So that is your answer to question number 8. On molar, depressions immediately distal to the mesial marginal ridge and immediately mesial to the distal marginal ridge are your triangular fossa. Okay, letter A. Okay? Hindi pwede si central fossa kasi wala naman siya sa gilid where your marginal ridges are. It's at the center. Interdental spaces are not depressions on a tooth. Proximal concavities are not also depressions on a tooth. Okay, or okay, they could be considered concavities, but we call them depressions. Spillways are your embouchures. Okay, now triangular fossa can sometimes be found on maxillary central and lateral. Okay, at the edge of the lingual fossa, where marginal ridges and your cingulum. So you have there a triangular fossa, but it's not always, okay, so it is only sometimes present. Developmental groove. These are shallow groove or lines between primary parts of the crown or the root. What are the primary parts of the crown? Cusp. So a developmental groove is found in between your cusp. Okay, so developmental grooves are formed or found, okay, on in between cusps. Okay, they could also be found on roots, but more commonly between your cusps. Now, supplemental groove, this is a shallow linear depression on the surface of a tooth. They are less distinct and they do not mark, okay, the junction of your cusp or your primary parts. Okay, now I forgot to mention, developmental grooves during development will separate lobes in your molars, in posterior teeth. Now, how about developmental lobes in anterior teeth? What separates them? Developmental depressions. Developmental depressions will separate lobes in anterior teeth. Okay, so developmental groove will separate, yes, very good, lobes in posteriors, while developmental depressions will separate lobes in anterior teeth. Okay, now pits, they are small pinpoint depressions. And where can we find pits? Okay, you could find pits at the junction of grooves. Kunwari, bakal, lingual, central groove, you have a pit. Kung saan sila nagkaroon ng kanto, ng meeting area, or at the termination of your grooves. Okay? Kung saan nag-terminate si mesial, distal groove, may pit. Mesial groove, may pit. Buccal groove, may pit. Lingual groove, may pit. Diba? Okay, so you have pits at the termination of your grooves and at the junction of grooves. Okay, so central pit, this is a landmark in the central fossa of molars where developmental grooves join. Okay, but is there a premolar with a central pit? Yes or no? Yes, meron. Anong premolar ang merong central pit? There is only one. Premolar with a central pit. Yes, again, your mandibular second premolar. All mandibular second premolars? No, again, it's the Y side. Okay. Balik pala tayo dun sa developmental groove. Itong central developmental groove. Do all posterior teeth have a developmental groove? Lahat ba ng posteriors, ito na lang tayo para mas central developmental groove. Do all posteriors have a central developmental groove? Yes or no? So maxillary first premolar meron, maxillary second premolar meron, maxillary first, second, third molar meron. Okay. Mandibular first premolar, meron ba central developmental groove? Wala. Okay, no. Okay, so all posteriors except mandibular first premolar. It is the only posterior without a central developmental groove. Yan, wala siyang, kaya nga di ba, snake's eye siya. Kasi wala siyang central groove. Only posterior tooth without a central groove is your mandibular first premolar. Okay. Now, enamel surface junctions. Okay, you have a line angle. This is formed by the junction of two surfaces. Okay, union of two surfaces. In anteriors, how many line angles? 6. In posteriors, 8 line angles. Unprepared to ha, once you do a cavity preparation, you will change the number of line angles. Point angles, they are formed by the union of 3 surfaces, okay? And whether it's an anterior or posterior, you form 4 point angles. Ulitin ko, pag line angles, 6 sa anteriors, 8 sa posteriors. Pag point angles naman, you form 4 point angles, whether it's an anterior or a posterior tooth. Okay. Now, contact areas. Okay. These are areas where one tooth touches an adjacent tooth. Okay. So, contact areas tayo. Now, contact areas occur on which part of the tooth? Saan ba nagkakaroon ng contact? Okay. So, liken nyo yung tooth ninyo sa fist ninyo. Pag pinag-contact natin siya, meron lang part dyan na mag-contact. Yes, you could find it on the proximal surface, mesial and distal, but do you find it on the entire proximal surface? Okay. Very good. Dito daw siya nahihilo. Okay, hindi ka mahilo ngayon. Okay? Contact areas occur only. So yes, you find them. Location nila would either be mesial and distal. Surface of the tooth. Tama? But not the entire mesial and the distal are in contact. Correct? Okay. So, anong part ng proximal surface ang nagko-contact? Tama. The height of contour. Or greatest convexity of the tooth. Or greatest curvature of the tooth. Okay? Tingnan nyo yung tooth niyo. Hindi naman straight yan. Kasi kung straight, buo yan magkukontact. But they have convexities. Yan. So kung saan yung greatest convexity, dun lang sila magkukontact. Okay, now, functions of the contact areas. They stabilize the arch, prevent food impaction, protect the interdental papillae of the gingiva by shunting food toward the buccal and the lingual areas. Okay? So, di ba kaya nga even when you are restoring teeth proximally, you need to restore contact. Okay? Kasi nga, for arch stability, hindi mag-move yung arch natin. Kasi kung walang contact yan, you have a mesial, a tendency for the tooth to drift mesially throughout life yan. Nag-drift talaga ang tooth natin. So, anong mangyayari? This will be occupied by this tooth. Anong mangyayari sa arch length? Magdi-decrease yung arch length natin. Okay? So, yan yung reason why we restore contact. Now, let's generalize. When you're looking at contact areas from the facial or even from the lingual, they will never be in the cervical third. So from the facial or lingual, saan lang yan? Okay, nag-divide tayo ng tooth natin. Okay, wala sa cervical third. Tama? Walang contact. Okay? So saan lang pwedeng magkaroon ng contact? It's either the incisal or occlusal third. Yan, o, dito, di ba? It could be the middle third. Or it could be at the junction of incisal or occlusal third and middle third. Diyan lang pwede. Hindi pwedeng magkaroon ng contact sa cervical third. The mesial contact area, yan, if you're looking at one tooth, kunwari, the central incisor, if you're looking at it, the mesial contact area is more toward the incisal or occlusal than the distal contact area. Mas mababa, in layman's term ulit, mas mababa ang mesial kaysa distal contact area. O ito, di ba? Canine, mesial contact area, distal contact area. And when you are looking at two teeth, posterior, one anterior and one more posterior, the more anterior the tooth, the more incisal or occlusal the contact areas are. Okay? So those are the generalizations. Now, paano kung, so alam niyo na yung general rule. Okay? Lahat ng ngipin will follow this. Okay? But sorry, meron pala akong exception dito. The mesial contact area, sabi natin, is more towards the incisal or occlusal than the distal contact area, except one tooth. Anong tooth ang may contact areas at the same level? Walang mas mababa, walang mas mataas. Okay? So contact areas are at the same level on what tooth? Very good. Okay? Mandibular central incisor. This is the only tooth where both mesial and distal contact areas are at the center. Now, paano kung specific yung question na sa inyo? Okay? Kunwari, where can you find the mesial contact area on the maxillary central incisor? We now have this mnemonics. Okay, I for incisal third, M for middle third, and J for junction of incisal and middle third. Yan. So, tingnan natin, this is your central, para dun sa mga nalilito, this is the chance na hindi na tayo malito. So, if you have questions regarding this, itanong na natin lahat ngayon kasi lumalabas siya, class. Okay, so sayang naman, di ba, kahit isa, dalawa yan, pampadagdag yan sa grade, di ba? Wait lang. Doc, wait lang ha. Okay. Lang po. Paulit lang po, yung sa same level. Okay. Ang same level lang ang contact area ay mandibular central incisor. Yung mesial at yung distal niya, same level. Okay? Hindi mas mababa, hindi mas mataas yung isa. Kasi in all other teeth, yung mesial, yung mas mataas, yung distal, yung mas mababa. Excuse me for using layman's term. Para lang mag-grasp nyo yung concept. So yung isa mas occlusal, yung isa mas cervical. So mas mataas, mas mababa. Ganun yon. Ang mesial, yung mas mataas, yung distal, yung mas mababa. Okay. Now, so meron tayo ditong 8 pairs. Okay, actually 7 pairs, then isang single. So this is for the central. Ito yung lateral. Ito yung canine. First, premolar. Second, premolar. First, molar. Second, molar. Third, molar. Bakit to isa na lang? Kasi wala na siyang contact. Diba? Dun sa, wala tayong fourth molar. Kaya wala na siyang contact. Okay. Now, the first letter is the mesial contact area. The second letter is the distal contact area. Okay. Now, what did you notice? Lahat ng posteriors, nasaan ang kanilang contact area? Where is the contact area located in your posteriors, mesially and distally? Very good. For your posterior teeth, the contact areas are at the middle third. Okay, now, same level ba? Yes or no? Are they at the same level on the middle third of the tooth? Yes or no? Same level ba? Kasi parehong M? Are they at the same level? No. Okay? Anong sabi natin? Ang mesial contact area will always be more occlusal than the distal contact area. Again, middle third man yan, but rules apply. Okay? Middle third lahat yan, but rules apply. Okay? Kasi malawak naman yung middle third natin. Yan lahat yon. Okay? So, kagaya nito, middle third, but the mesial is more occlusal than the distal contact area. Tama? O, ito ulit. Middle third, pero the mesial is always more occlusal than the distal. Tama, they are not at the same level. Yan o, not at the same level pa rin sila. Okay? And the more anterior the tooth, ito mas anterior to kaysa to, mas mababa yung contact, mas mataas yung kanilang mga contact areas. Okay, so bumababa yung kanilang contact areas. Okay, so that's contact area for maxillary. IJ, JM, JM, M. Okay, o sige, burahin ko to, mag-drill tayo para ma-apply ninyo yung rule natin. Okay, where is the distal contact area of a maxillary second premolar? Posterior lang ang middle third, pero ito yung anteriors. Lahat ng ngipin na to. Okay, lahat ng ngipin na yan. Okay, so distal contact area ng maxillary second premolar, it's in the middle third. Okay, another question. Where can you find the mesial contact area on a maxillary canine? O, ito yung canine nyo. Asan yung mesial contact area? Ano yung J? Junction of the incisal and the middle third. Okay, another. Where can you find the distal contact area on a maxillary central incisor? O, ito naman si central incisor. Nasaan ulit? Yes, junction pa rin siya. Okay? Questions dito sa maxillary contact area. Questions. So, kapag nag-memorize tayo nitong mnemonics na to, memorize nyo na lang yung anteriors. Tama? Kasi lahat naman ng posteriors natin nasa middle third. So, you don't really need to memorize them. So, how do you memorize it? IJ, JM, JM, M. Tama? IJ, JM, JM, all the rest M. Okay, correct? Diba? Ang dali na lang. Okay. Now, gagayahin din natin ito sa mandibular. Pero syempre, iba na yung mnemonics. Kasi iba na yung contact area nila. Again, pag maxillary, IJ, JM, JM, M. Diba? Mas pinaiksi pa natin yung mnemonics na nasa book. Okay? So, IJ, JM, JM, o M na. O, tama na. Hanggang M na lang kayo. Okay. Now, how about your mandibular teeth? Okay? Ganon pa rin. Yung posteriors ninyo, nasa middle third pa din. Again, question. Are they on the same level? Ito bang nasa middle third na to? Magkaka-level ba yan? Yes or no? No. Which one is more occlusal? Middle or, mesial or distal? Ano yung mas nasa occlusal? Yes, very good. Yung mesial contact area. Yung distal contact area ay nasa mas cervical. O, tingnan nyo, di ba? Yung distal mas cervical. Yung mesial, mas occlusal. Correct? Okay, so lahat yan. And then, for the anteriors ulit, i-memorize natin. I, M. And then M. Diba? O, sige. Ano ulit dyan ang nasa same level? What contact areas are exactly at the same level? Yes, ito lang yung same level. Okay, ito kahit parehong incisals they are not at the same level. Again, yung distal mas cervical than the mesial contact area. Okay, question ulit ako. Where can you find the distal contact area on a mandibular canine? Nasaan? Ito yung canine. So, nasaan yung distal? Yes, it's in the middle third. Okay, another question. Where can you find the mesial contact area on a mandibular third molar? Oh, ito si third molar. Yes, it's also on the middle third. Another question. Where can you find the distal contact area on a mandibular central incisor? Ito si central incisor. Ito si distal contact area. Yes, it's in the incisal third. Oh. If you are still confused, let me know now. Ano yung question pa ninyo sa contact area? Mnemonics natin. May question pa ba dito? Malinaw ba? Okay, or do you want it repeated? O, diba? Pinadali na natin. Okay, yung contact areas ninyo. Alright, let's answer a question. Yes, okay. May question daw. Wait lang ha. Hindi. Okay, IJ. Okay, IJ. IJ, ito, incisal third. Ang J lagi, J is junction of incisal and middle third. Okay, sa MM, first na M, middle third pa rin. Okay, nalilito ata kayo sa ibig sabihin ng I ng M. Okay, so dito tayo. Okay, burahin ko lang. Dito sa I, yung mga, dun muna tayo sa ibig sabihin ng mga letters na to. Yung I is incisal third. Yung M ay middle third. Okay. Yung J ay junction of incisal and middle third. Okay. Yan. Ngayon, ang contact area natin, saan natin ulit makikita? Nasaan ang contact areas natin? On what surfaces or surface? Nasa mesial at distal. Tama? So proximal. Kaya may dalawa kayo dyan. Laging pares yan except for the third molars. Kasi wala siyang distal contact area. So the first I, ano ulit ibig sabihin ng I? So dito sa I, dalawang I yan. The first I is, anong ibig sabihin ng I? Incisal third. The first I is your mesial contact area. Ibig sabihin, sa mesial, ang contact area niya ay incisal third. Ano yung second na I? Distal contact area. Meaning to say, sa distal, ang contact area niya nasa incisal third pa din. Okay, eto. Sa MM, anong ibig sabihin ng first M? M is for middle third, tama? Okay, but anong ibig sabihin ng first na M dito? It's the mesial contact area. At ito ay distal contact area. Okay, okay na tayo? Ayan, meron pa tayong questions sa contact areas. Okay na? We could answer this question. Okay, wait lang. Burahin lang natin. Hindi na natin mabasa. The proximal contact areas of anterior teeth are incisal to the middle third of the teeth. Incisal to the middle third daw of the teeth. Anteriors to, ha? Okay, anteriors. Meaning to say, canines, central lateral canine are incisal. Okay, so dun sa maxillary posterior, more occlusal ba yung middle third contact? Yes, in all teeth. In all teeth, except for the mandibular central incisor, the mesial contact area will always be occlusal, more occlusal than the distal contact area. Okay? So, okay ha, kasi may nag-question, sa posteriors daw ba mas occlusal ang mesial contact area? Yes. In all teeth, rules follow. Okay, so rules would follow pa rin. So the proximal contact areas between anterior teeth are incisal to the middle third of the teeth. Okay, which of the following is an exception to this rule? Sige, tingnan natin. What's your mnemonics for the maxillary anteriors? Maxillary anteriors. Maxillary, yes. IJ, JM, JM. Okay. Mandibular is, ano yung mandibular? II, yes, II, IM. Okay, tingnan natin. Ano ang mesial contact ng maxillary canine? Mesial contact area? Maxillary canine? Oh, ito. Ano dyan? Ito yung maxillary canine. Ano dyan yung mesial? Yes, J. Distal contact area of the maxillary canine. Ito naman maxillary contact area. Ano dyan yung distal? KM. Okay. Mesial contact area of a maxillary lateral incisor. Ito naman. Mesial. Okay. Ito rin. J. Tama? And mesial contact area of a mandibular lateral incisor. Ano naman? I. Okay, tama. Ang sabi niya, it is incisal to the middle third of the teeth. Okay, except, meaning to say, wala siya sa incisal third or the junction of the incisal and the middle third. So anong answer niyo dyan? What's your answer? Yes, the distal contact area of a maxillary canine kasi siya lang yung nasa middle third. Ang hinahanap niya, anterior na either, kasi ano ba yung incisal to the middle third? Okay, kung ito yung ngipin natin, divide natin siya into 3, ito yung middle third. Tama? Incisal daw siya. So ano ba yung mga incisal? Ito yan. Siyempre, andyan yung incisal third at yung junction. 'Di ba? Between these two. Kaya ito yes, yes. So the correct answer ito kasi nasa middle third na siya. So number 9, the correct answer is letter B. Okay. Number 10, in which of the following anterior teeth would at least one contact area be located within the middle third of the crowns incisogingivally? Ano ulit yung mnemonics natin for the maxillary anteriors? IJ, JM, JM. Tama? For the mandibular, it's II, IM. Sabi niya, anterior teeth would at least one contact area be within the middle of the crowns. Okay, so maxillary central, IJ. Tama? Okay. So walang middle third. Maxillary lateral, JM. So ito pwede. Maxillary canine, JM. So pwede. Mandibular central, walang middle third, di ba? Mandibular lateral, walang middle third. Mandibular canine, IM. Would at least one contact area be within the middle of the crowns incisogingivally? Middle, middle, middle. So maxillary lateral, maxillary canine, and mandibular canine. So B, C, F. Okay, ano dyan? Letter D. Yes, very good. B, C, and N. Diba? Medyo nakakalito when you're already applying it, but always stick to your mnemonics. Yan. Always stick to your rules. Ano yung rules natin? Mesial contact area is always more occlusal than distal contact area. Okay? Except for your mandibular central incisor. Okay, and as you go posteriorly, the more anterior tooth would have a more incisal or more occlusal contact area. Then you apply your mnemonics. Okay, so you have IJ, JM, JM, M for the maxillary and maxillary teeth, IM, M for the mandibular teeth. Okay, questions, clarification. Before we discuss heights of contour kasi very related siya sa contact areas. Then after heights of contour, we'll have a break, a short break. Okay, wala na? Okay, so heights of contour naman tayo. Okay, ano ulit ang heights of contours where contacts occur? Tama? Diba? This is the area where you have your contacts. Nasaan ulit ang contacts? Mesial at distal only. Correct? So heights of contour are also known as the crest of curvature. So they form the contact areas and they protect the gingiva surrounding the tooth. Now, ang mesial, ang height of contour can be found not only on the mesial and distal. Meron din kayong labial at lingual. Tama? So halos lahat ng surface except occlusal and incisal may height of contour. Now, saan located ang height of contour? Mesially at distally, saan din located ang height of contour? Labially, facially, I mean, and lingually. Okay. So for proximal, meaning to say mesial at distal, the location would be the same as your contact areas. So you could use the same mnemonics for your heights of contour. Same as the mnemonics for the contact areas. Again, kunwari, ang tanong ko sa inyo, where can you find the height of contour on the distal of a maxillary first premolar? What's your answer? Distal. Okay, so maxillary, ano yung mnemonics natin? IJ, JM, JM, M. Diba? Yes, very good. Middle third. Okay, diba? Where is the height of contour on the mesial of a maxillary canine? Maxillary canine. Yes, it's at the junction. So same lang. Ang height of contour, mesial at distal at contact areas. Okay, now, paano naman pag facial? Facial height of contour. Saan naman siya located? For all teeth, nasa ng facial height of contour? It's at the cervical third. Huwag malilito. Pag contact areas, hindi pwede sa cervical third. Ang contact areas, mesial at distal lang. Okay? Height of contour at contact areas, pareho ng location. Now, facial, height of contour naman tayo. Nasaan? Cervical third. Okay? Pero pag, yan, okay, nasa cervical third. Pag lingual height of contour, magkaiba na ang anteriors at ang posteriors. Okay? So kapag lingual height of contour sa anteriors, cervical third pa din. Okay? Sa posteriors naman, middle third. Again, mesial at distal, same as contact areas. So you use the same mnemonics, IJ, JM, JM, M. So IJ, JM, JM, M. For maxillary, for mandibular, M, mandibular. Okay? So same as contact areas. Pag facial height of contour naman, lahat ng ngipin, anterior or posterior, cervical third. Yan. Cervical third. But if it's on the lingual, the height of contour for anteriors is still at the cervical third. It's at the cingulum, exactly there. And for the lingual of posteriors, it's at the middle of the middle third. Okay, so simply put, it's at the middle third. Well, let's answer question number 11. On the crown of the maxillary canine, the height of contour, crown daw, ng maxillary canine, the height of contour is normally located in the cervical third of which of the following surfaces? Anong answer niyo dyan? Labial, lingual, both labial and lingual, neither labial nor lingual. Very good. Labial third, pag anteriors, di ba? Pag labial, it's cervical third, lingual, cervical third pa rin. So yes, both labial and lingual. Okay, number 11, the correct answer is letter C. Number 12, which of the following represents the location of the lingual height of contour on the crown of mandibular second premolar? Ano yung rule natin pag lingual? Ng anteriors, cervical third. Pag posteriors, it's in the middle third. Very good. Yes, the correct answer is the middle third. Walang height of contour sa occlusal third. So yan, maling-mali talaga. Same third as the tooth's buccal height of contour. No, kasi ang buccal height of contour is in the cervical third. Same third as the lingual height of contour on the crown of the maxillary premolars. Okay, ito pwede rin naman. Okay, kasi pareho silang posteriors, pero you have a more specific answer. Okay, so the correct answer is letter A. Okay, the middle third. Okay, so the next concept is about embouchures. Okay, but before we proceed, it's 10:01. Let's have a short break. Okay, so let's have a 15-minute break. So I'll see you after 15 minutes.
Okay, let us now continue our discussion. Okay, so let's now discuss embrasures. Okay, so these are what you call your spillways. Okay, so they are triangular shaped spaces between the proximal surfaces of adjacent teeth. So whenever your teeth are in contact, kasi nga, hindi naman sila flat yung surfaces nila, nagkakaroon ng spaces, right? And these spaces are what you call your embrasure. So if there is contact, there is an embrasure. Kung walang contact, wala ring embrasure form. Okay? So, how many embrasures are formed per contact area? Ilan ang nafo-form natin na embrasures? We form 4. Yes, very good. You form 4. Ano-ano yung mga embrasures na to? You have incisal for anteriors, occlusal embrasure for posteriors. You have gingival or cervical embrasure. Then you have your facial, so labial for anteriors and buccal for posteriors and lingual. Okay, for all teeth. Yan. Okay, so lingual embrasure. Those are the 4 embrasures. Number 13, when proximal surfaces of adjacent teeth diverge from an area of contact, kasi nga hindi flat yung surface, an embrasure is formed. What's your answer? Lingually only? Hindi, di ba? 4 nga. Lingually and facially? Hindi, dadalawa lang yan. Dalawa din lang. Lingually, facially, occlusally, cervically. Yes, very good. It's letter D. So functions of embrasures, again, they are spillways to direct food away from the gingiva. So they make your teeth more self-cleansing kasi they direct food away from the gingiva. Okay? And through that, yung teeth natin hindi rin nagkakaroon ng mga tinga-tinga, okay, or mga food particles. So they protect the gingival tissue from frictional trauma because they direct food away from the gingiva. And whenever they direct food away from the gingiva, nag-i-slide yung food sa gingiva, providing a massaging effect or a stimulating effect to your gingiva. Okay, another concept, okay, on your tooth, you have the cervical line curvatures or the cervical line or your cemento-enamel junction or your CEJ. Okay, rules on CEJ. Maxillary CEJ is always greater in curvature than mandibular CEJ. Let's compare. This is your maxillary central. This is your mandibular central. Mandibular at maxillary. Look, diba? Mas curve, malaki yung curvature sa CEJ ng maxillary kesa mandibular, whether it's distal or mesial. Anterior, greater than posterior. Let's compare these 2 teeth. Yan. Ito anterior, central, ito yung lateral. So mas posterior si lateral. Look at their CEJs, diba? Mas malaki yung curvature sa mas anterior na si central kesa sa mas posterior na lateral. Again, mesially and distally. And on the same tooth, you would notice that the mesial is greater than the distal CEJ. Question, what tooth has the greatest cervical line curvature? What's your answer? What tooth has the greatest cervical line curvature? It's your maxillary central incisor. What surface? Mesial surface. And it measures 3 to 4 millimeters. So average of 3.5 millimeters. So 3 to 4 yan actually. So the average is 3.5. Okay? So other rule, facial and lingual CEJs will curve apically. Yan, tingnan nyo, when you're looking at it from the facial or from the lingual, pareho lang, the curvature is towards the root, so apical. Okay. While if it's on the mesial or the distal, the curve is towards the crown. Okay, so mesial and distal CEJs curve coronally. Okay, now outlines of your tooth crowns fall only. Crowns lang to ha. We're not gonna talk occlusal outline kasi iba-iba talaga yon. But we are going to classify together the shapes of your crowns from the mesial and distal and from the facial or the lingual.
Okay, so there are only three shapes. You have a trapezoid. Ito, trapezoid lahat yan. Ano yung difference nila? You have a trapezoid with a longer side on the incisal or the occlusal. Ito yon. Okay? And there is a trapezoid with the longer side on the cervical. Baliktad. Diba? Ito, yung longer side nasa occlusal or incisal. Ito, yung longer side nasa cervical. But they are still trapezoid. Now, ano yung trapezoid with the longer side towards incisal or occlusal? All teeth. Okay, what view? All teeth from facial or lingual view. Yan, lahat sila. Anteriors, posteriors, basta facial at lingual, trapezoid. Okay, kung mas gusto niyo maging specific, longer side on the incisal or occlusal. Okay, now ano naman yung isang trapezoid? Ito, mesial at distal ng alin? Maxillary posteriors. From the facial at lingual, trapezoid na siya. When you're looking at the mesial or distal, trapezoid pa rin siya. Okay. Now, how about a triangle? Ito, mesial at distal ng anteriors. But remember, ang anteriors from facial at lingual ay trapezoid. Diba? Pero sa mesial at distal niya, triangle. Okay? And then rhomboid, this is the mesial and distal of your mandibular posteriors. Okay? So meaning, yung kanilang, yung facial at lingual nila, ay a trapezoid shape pa rin. Okay? So lahat ng facial at lingual trapezoid, ang mag-iiba-iba lang yung mesial at distal. Pag anteriors, triangle. Pag mandibular posteriors, rhomboid. Pag maxillary posteriors, trapezoid. Okay, so let's now discuss your primary teeth. So nandun na tayo sa third bullet natin. Actually, we're running late, pero sige lang. Okay, I want you to have a good grasp of the concept as of this point. Kasi nasa final coaching na tayo, di ba? So gusto ko lahat ng hindi nyo naiintindihan, maintindihan nyo ngayong final coaching. Alright? So these are the general characteristics of your primary teeth. So overall dimensions niya, syempre, smaller than permanent. Crown length, root length, okay? So mas maliit siya. Mesiodistally, facial-lingually, mas maliit talaga siya, whether anterior or posterior. Now, the enamel of primary teeth are whiter. Okay, so as you could see here, this is permanent. This is your primary. Okay, why are they whiter? Because you have a more opaque enamel crystals. Okay, so more opaque enamel crystals. Enamel is also thinner, okay, on primary teeth, and it's less calcified, less minerals, okay, yung content niya. And it stops abruptly at the CEJ. It does not overlap your cementum, nagmi-meet lang sila. And there are no mamelons upon eruption. Now, number 14, which of the following represents the usual color of the crowns of primary teeth? What's the usual color again? Okay, primary teeth? Yes, it's not grayish white, it's not yellow white, it's not even darker than the permanent. It's not of the same color, but it is whiter. Okay, than the crowns of your permanent teeth. So number 14, the correct answer is letter E. Another difference on the enamel of your primary teeth would be the orientation, okay, orientation of your enamel rods in the gingival third. O, ang pinag-uusapan lang natin is the gingival third. So dito lang, kapag primary, your gingival third enamel rods are oriented occlusally. O, primary, occlusally. Pag permanent naman, either horizontal or apical. Okay. Ano nga yun? What's the significance of knowing that difference? When you're creating a class 2 cavity preparation, you need to bevel the gingival cavo-surface margin. Nasaan yon? Gingival ha, cavo-surface margin, hindi yan beveled. Okay? Pero ang gingival cavo-surface margin ay beveled. Okay, nasaan yon? Kung you are creating this palpal floor, axial wall, gingival, so ito yung proximal box, gingival floor, ito naka-bevel. Okay? Pero ano ang may bevel? This is necessary for permanent. Okay, only. Meaning to say, in the primary, there is no bevel needed. Why do you need a bevel? Okay, to remove undermined enamel, okay, on that area. Okay, so that's the reason why, okay, we have that bevel on a primary tooth. So the orientation of the gingival enamel rods create undermined enamel. That's why we need to bevel. But in a primary, there are no overhangs, or sorry, not overhangs, no undermined enamel form. So we do not bevel anymore. Okay, so that's the difference. Dentin is also thinner, so it's easier for caries to reach your pulp. Ito, di ba? Very thin. The crown is a smaller percentage of the tooth. They have very short crowns. Okay? Kaya if you compare, or if you get the ratio between the root and the crown, you have a greater, okay, root to crown ratio on primary. Kasi pag permanent, almost equal. Okay? Almost equal root to crown ratio. Pero sa primary, you have a greater root to crown ratio. Kasi nga very short yung kanilang crowns. Now, anterior crowns are wider mesodistally and shorter incisor-cervically. Okay. Posterior crowns, they are narrower mesodistally than the permanent and also shorter occluso-cervically. Diba? Sabi nga natin, primary teeth are smaller than permanent. They have shorter roots, shorter crowns, narrower crowns mesodistally, and even facio-lingually. Mas maliit in all dimensions. Crowns are more bulbous. Reason for that would be your cervical ridges. They have more developed cervical ridges. And remember, sa primary, lahat ng primary teeth may cervical ridges. Okay? Yan. They have smaller occlusal tables. Yan. Smaller occlusal tables. And they have fewer grooves and pits. Kaya nga we seldom do pit and fissure sealants on primary teeth. Okay? We do pit and fissure sealants on permanent kasi fewer yung grooves and pits nila. Buccal and lingual surfaces are flatter above the heights of contour compared to your permanent. CEJ, they are also more constricted, kaya may narrowing of the cervical. So you have a cervical constriction, okay, form. Cervical constriction. Roots have little or no root trunks. Okay, no root trunks actually. Roots are longer and more slender relative to crown size. Diba? Greater root to crown ratio. Longer, more slender relative to crown size. Not longer than the permanent, definitely not, but longer in relation to your crown size. They are more tapered on anteriors and more divergent on posteriors. Bakit ulit divergent sa posteriors? To accommodate the developing a permanent tooth buds. Okay, so that's, yes, very good, for the succedaneous tooth bud to develop. Kaya nag-flare sila. They have higher pulp horns and larger pulp chambers. So it's easier to sensitize, okay, a primary tooth. They could feel sensitivity easier, okay, like when they're eating ice cream compared to adults because they have larger pulp chambers. Number 15. Primary teeth differ from permanent teeth in that primary teeth, A, have larger crowns compared with their mesiodistal diameters. Wrong, di ba? They have shorter crowns compared with their mesiodistal diameter. So mesiodistal greater than height of crown. Okay, although this is more of a primary central incisor. Okay. Are smaller mesiodistally than their replacement teeth? Mas maliit ba sila? Yes, okay. So yes, mesiodistally. Replacement teeth kasi yung permanent premolars are smaller. So hindi. Okay, not all yan. Have comparatively larger pulp cavities? Yes. Less pronounced cervical ridges? No, they have more pronounced. Have wider crowns faciolingually? No. Okay, they have smaller crowns faciolingually. So yes, the correct answer is letter C. Okay. Diastemas are common. What's the cause of diastemas? Growth of the dental arches. Nag-grow ang arches natin, nagiging longer, kaya hindi siya, ang mga ngipin hindi naman lumalaki, kaya nagkakaroon ng spaces in between teeth. Now, two notable spaces can be found in your primary teeth, and we call this your primate space. Where can you find a primate space in the maxillary arch? It's mesial to the canines. Yes. So between your canines and lateral incisor. While on the mandibular arch, it's distal to the canine. Okay, so between your canine and first molar. Okay, so that's your primate space. So maxillary, it's mesial to the canine between canine and lateral. Mandibular, it's distal to the canine between the canine and the first molar. Number 16, between which of the following teeth in the primary dentition is the mandibular primate space usually found? It's distal to the canine. Diba? So it's between, yes, very good, the canine and the first molar. Pag maxillary naman, maxillary primate space, it's between the lateral and the canine. Okay, so maxillary primate space is between the lateral incisor and the canine. It's mesial to the canine. Okay, so function of the primate space to allow for proper alignment of the permanent incisors. Arch, it's more circular. It's not horseshoe shape in the primary teeth. Length for the maxillary arch is 68.2. Mandibular arch, it's 61.8. Okay, all teeth in the primary dentition are replaced by the same teeth in the permanent, okay, except for the molars, except your primary molars, because they are not replaced by the permanent molars. They are replaced by your premolars. Primary teeth generally resemble the teeth that replace them, again, except for the primary molars, okay, because they do not look like your permanent premolars. Okay, so there are two types of permanent teeth. You have your succedaneous, they replace your primary, and your non-succedaneous. Succedaneous are from central incisors to premolars. Non-succedaneous are your molars. Okay, so those are your primary teeth characteristics. Now, all primary anteriors, so from centrals to laterals, look the same as their permanent counterparts, except for the following. They have smoother labial surface, they have no mamelons, they have a more prominent cingulum, they have cervical constricture and straighter incisal edge. All primary anteriors have this characteristic. Yeah, smoother labial surface, they erupt without mamelons, more prominent cingulum, they have the cervical constriction, okay, and straighter incisal edge. Now, let's answer. Which among the primary anteriors has a crown height that is less than its mesiodistal measurement? So mesiodistal greater than crown height. Length of the crown. Anong tooth ito? This is characteristic of your primary maxillary central incisor. The mesiodistal width is greater than the crown height or the crown length on a primary maxillary central incisor. Next, which among the primary anteriors has a more prominent lingual anatomy than its permanent counterpart? Actually, all your anteriors have a more prominent lingual anatomy than their permanent counterparts. All. Okay, but what again is the permanent with the most developed lingual anatomy? Permanent tooth with the most developed lingual anatomy. Yes, your maxillary lateral incisor. Your your primary maxillary lateral has an even more developed lingual anatomy. Yan. Kaya nga, lahat ng lingual anatomy ng primary natin mas develop or mas prominent kesa sa permanent. Okay, next. Which among the primary anteriors is pentagonal from the facial view? Di ba sabi natin pag facial view, trapezoidal, trapezoid. Ang mangipin natin, ito hindi. It is not a trapezoid. Yes, very good. Primary, maxillary, canine. Hindi siya trapezoidal, pentagonal siya. Okay, next. Which among the primary anteriors has a longer mesial cusp bridge compared to the distal cusp bridge? Kasi, okay, o cusp bridge ito. Okay, so meaning to say, ano yan? Canines. Sa canines yan makikita. Usually, ang rule, okay, rule natin on cusp bridges. So canines and premolars. Okay, primary, permanent. Okay, rule on cusp bridges. The distal cusp bridge is always longer than the mesial cusp bridge. Okay, so distal cusp bridge is always longer than the mesial cusp bridge. Okay, now, there is a primary tooth which has a longer mesial cusp bridge than distal cusp bridge. So, iba siya. It doesn't follow the rule. Okay? So, longer mesial cusp bridge is seen again on a primary maxillary canine. Yes. Okay? There are only two teeth. Okay? With longer cusp bridge compared to distal cusp bridge. You have the primary maxillary canine, this is one, and one on the permanent. You have your maxillary first premolar. Yes, very good. On these two teeth, their mesial cusp bridge is longer than their distal cusp bridge. Next, which among the primary anteriors has a longer and sharper cusp than its permanent counterpart? So cusp na naman to. Ano bang anterior ang may cusp? What anterior has a cusp again? Okay. Exception sa cusp bridge. Ito, exception sa cusp bridge. Again, the rule is the distal cusp bridge is always longer than the mesial cusp bridge, except for two teeth. One in the primary, one in the permanent. Primary, maxillary canine, and permanent maxillary first premolar. Okay. Now, anong anterior ang may cusp? Kasi cusp dapat posterior, di ba? Yes, very good. So, canine yan. Now, Ano ang may longer and sharper cusp? What canine has the sharpest cusp? Maxillary canine. Maxillary permanent canine. Now, your primary maxillary canine has an even longer and sharper cusp than your permanent maxillary canine. So the answer to this question is the primary maxillary canine. Which among the primary anteriors has a more exaggerated incisal edge loop than its permanent? Saan ba natin nakikita ang incisal edge loop? Okay, so meaning to say, yung kanyang crown, okay, gumaganyan. Incisal edge loop. Because the mesial surface is longer than distal surface. Anong tooth yan? Maxillary lateral incisor. So you have your primary maxillary lateral incisor. Mandibular lateral incisor. Ito yan. Okay? So mandibular, yan, nag-slope yan. Okay? It's not at the same level, okay, nag-slope down yung kanyang incisal edge. Okay? The primary mandibular lateral. Which among the primary anteriors is arrow shape from the facial? Arrow shape. Mandibular canine. Yan, kasi arrow. Yan. Okay, so arrow shape siya. Okay, so arrow shape, okay, from the incisal. Yan. Okay, so mandibular canine. Now, let's discuss your molars kasi sila yung iba talaga dun sa kanilang counterpart because they are replaced by your premolars. They do not look like them. So the maxillary primary first molar is the most atypical. Why most atypical? Okay, because it looks like a cross between, okay, looks like a molar and a premolar. So molar siya kasi tatlo yung root niya, maxillary molar and premolar. Tatlo yung root niya, pero yung crown size at shape niya, mukha siyang premolar. That's why authors believe that this is the premolar section of your primary teeth. So they are the smallest primary molar. Number 17. Which primary molar has a crown, o primary molar daw has a crown resembling a permanent premolar, but the root form is typical of a permanent molar? Yes, your maxillary first molar. It has three roots like a permanent molar, but the crown, it looks like a premolar. So it has four cusps. Kahit maliit yung crown niya, may four cusps pa rin yan, typical of a first molar. You have the mesiobuccal, which is the largest, the mesiolingual, which is the tallest and the sharpest, distobuccal, and then you have your distolingual, which is the smallest. Longest root on a maxillary first molar. Okay, ano yung longest root niya? Palatal. Okay. Shortest root is distobuccal. Similar as in your permanent. Ganyan din. Longest root niya, palatal root. Shortest root niya, distobuccal root. Okay, and they look like an elephant charging. Yan. When viewed from the lingual, this is the lingual view, this is the palatal root, you have the two buccal roots, and then you invert it. Okay, so yung root niya nasa baba. Okay, so it will look like an elephant charging. Peripheral outline is trapezoidal. Occlusal table outline is rectangular. Yan. It has an H-shaped pit groove pattern. Okay, you have a buccal developmental groove separating the two cusps, and this is a maxillary molar, so you have an oblique ridge. Again, what molar or what maxillary molar does not have an oblique ridge? Ano ulit yung maxillary molar without an oblique ridge? Yes, the third molar only. Okay, but maxillary first and second, whether permanent or primary, they have an oblique ridge. Mesial, you have an outstanding feature. You have a pronounced convexity on the buccal cervical third. This is your cervical ridge. Okay. Number 18. The cervical ridge would stand out most prominently as a distinct entity on which of the following primary maxillary molars? So alam natin na first, tama? Mesial or distal? Mesial. Yes, very good. Mesiofacial of the first. Letter A. That's number 18. Letter A. Second molar. Always remember that primary second molars will look like, resemble the permanent first molars. Okay? Primary second molars will resemble the permanent first molar. So the maxillary primary second molar resembles the maxillary permanent first molar except for the following. Okay. Ano po ulit yung number 18? It's letter A. Okay. So it's squarer and more bulbous. Okay, so mas bulky, kaya bulbous. Okay, kasi nga it has cervical ridges. It has a prominent mesiobuccal cervical ridge and it has very little root trunk. Okay, kasi nga this is a primary tooth, so wala siyang root trunk. Next, mandibular primary first molar, the most unique tooth. Bakit most unique? Does not resemble any tooth. Wala talagang kamukha. Okay. And this is the most difficult primary tooth to restore because of its anatomy. Very primitive ang anatomy, and because of its high pulp horns. Remember, pulp chambers are very wide and they have high pulp horns in the primary teeth. From the buccal, you have a prominent buccal cervical ridge. Yan. So yung buccal niya, that gives it a pregnant appearance. Okay. And then from the lingual, you have a rounded distolingual cusp. You have a prominent, long and sharp mesiolingual cusp, centered lingually and in line with the root, which is an outstanding feature of this tooth from the lingual. Okay, so it's in line with the mesial root, and you have a well-developed marginal ridge on the mesial. Occlusal outline is rhomboidal. Okay, the mesiolingual cusp is the most developed cusp. From the mesial, it will resemble the primary and permanent mandibular molars, but it has an extreme curvature on the cervical third, which is the most noticeable feature of this tooth. Okay, second molar, again, it will resemble the permanent first molar. So mandibular primary second molar looks like the mandibular permanent first molar, except that, okay, you have equal size of buccal cusp. Okay, so in the primary molar, the mesiobuccal, distobuccal, and distal are equal in size. In the permanent, the distal cusp, okay, eto ganito siya. The permanent molar distal cusp is smaller than the two cusps. From the buccal aspect, the primary mandibular molar has a narrow mesiodistal calibration at the cervical constriction, okay, compared to the calibration mesiodistally at the contact area. But for the permanent, it's the opposite. Okay, the permanent first molar is wider at the cervical portion. And they also have different groove patterns. Okay, now, what is the widest primary tooth buccolingually? Widest primary tooth buccolingually, this is your maxillary second molar. But the widest primary tooth mesiodistally is your mandibular first. Okay, yes, very good. Okay, so the largest primary tooth is actually your maxillary second molar. That's the largest primary tooth. Okay, now let's discuss occlusion, okay, for the primary dentition. When we are talking primary, wala pang permanent, we cannot use angles. Okay, so hindi pwede si angles. Why? Because angles classification is based on the permanent first molar. Diba? Eh paano kung wala pa? We cannot use angle. So the basis for classifying the occlusion of the primary dentition would be your maxillary and mandibular second molars. The is surface, distal surface. So the distal of the is, that's the basis. Hindi yung first molar. Okay, it's the second molar distal surface. Okay, so flush terminal plane, the distal of the is, fall in a straight line. Tama? Straight line siya. Okay, now the beauty of knowing how to classify occlusion in the primary dentition is you have you can predict how your success will erupt. Ito yung success. Maprepredict mo anong angles classification sila. So when the success erupt, okay, they erupt end to end. End to end din kasi nga flush. Is that normal? Normal ba ang end-to-end eruption ng success? Is that classified class 1? Normal ba? Hindi. Okay. End-to-end ba ang relationship ng success? No. Okay, no. But this is the most ideal occlusion for the primary. But then your sixes do not erupt class 1. Kasi pag class 1, dapat ito nakashoot dyan. Diba? But then they are end-to-end then. Okay, the mesial surfaces are in a straight line. Okay, so end-to-end because they follow this. Diba? End-to-end. But then there is what you call late mesial drift. Diba sabi ko nga, ang teeth natin may tendency to drift mesially throughout life. And because of late mesial drift, it will become class 1. So from end to end, later on, magiging class 1 din. That's why it's called the most ideal. Now, how about the mesial step? Let's look at the distal of the is. Do they fall on a straight line? No. Okay, so they are not in a straight line. Okay, so hindi siya straight line. Bakit hindi straight line? Kasi mas anterior yung mandibular E kesa sa maxillary E. Diba? Okay, creating a mesial step. Now, when the sixes erupt, okay, when they erupt, anong class to? Class 1, 2, 3. So ito. This is class 1. Class 2 groove, di ba? They erupt class 1. Okay, so you say, this is the ideal. Kasi nga class 1 agad pag nag-erupt. But remember, you have late mesial drift. So what will happen to class 1 after late mesial drift? From class 1, magiging class 3. Yan. Okay? Kaya wait and see moment kapag mesial step yung relationship. Titingnan ninyo, baka ma-maintain pa naman yung position ng success. Right? Now, the third type is the distal step. So we look again at the is. Do they fall on a straight line? Di rin. So it's not a straight line. Why is that so? Because your mandibular, okay, 6 is more distal than your maxillary 6, creating the distal step. Now, when the sixes erupt, they erupt class 2. Okay, so class 2 yan. Okay. Will it become normal with distal step? No, it will never become class 1 even with the occurrence of the late mesial drift. It will remain class 2. So pwede na tayong mag-intervene kapag alam na natin na class 2 talaga siya. Okay, so that's the occlusion for the primary dentition. So number 19. Which of the following primary molar relationships may lead to a class 1 occlusion in the permanent dentition? May lead to a class 1 occlusion. Tingnan natin. Distal step, hindi pwede. Class 2 yan. Diba? So wrong. it will never become class 1. Flush terminal plane, yes, but not distal step. Mesial step, yes, from class 3, magiging class 1. So class 3 to, class 1 to class 3. Okay. Ito naman, flush from end to end, magiging class 1. Okay, so correct. The correct answer, yes, it's letter C. Okay. Now we move on to your permanent teeth. Okay, so these are the general features of your maxillary and mandibular teeth. All teeth are wider faciolingually than mesiodistally, except for what teeth? So faciolingual measurement is greater than mesiodistal. Ano yung mga exceptions? Okay, 1, maxillary, central incisor. 2, mandibular, maxillary, lateral incisor. 3, 4, and 5, your mandibular molars. Okay, first, second, and third molars. So meaning to say, these teeth are wider mesiodistally than faciolingually. Okay, next. Premolars have single roots, except what premolar has 2 roots? Anong premolar ang may dalawang roots? Maxillary? Yes. First premolar. It has 2 roots, buccal and lingual. Maxillary molars, they have 3 roots. Ano yung tatlong roots na to? Palatal or lingual, distobuccal, and mesiobuccal. Mandibulars have 2 roots. You have a mesial and a distal root. Incisal edge placement. Okay. Ano dyan yung nakagitna? Okay, ang incisal edge. Faciolingually, labiolingually, maxillary. Okay, so incisal edge are centered faciolingually or labiolingually. Yan, tingnan nyo. If you put a bisecting line, labiolingually, nakagitna yung kanilang incisal edge. While for the mandibular, if you put, okay, if you draw a line that bisects the tooth labiolingually, you would notice that the incisal edge is lingual. Okay? Lingual to the bisecting line. Lingual to the bisecting line. Now, how about their occlusal table? It follows the same rule. Maxillary occlusal tables are centered buccolingually, while on a mandibular, yan, tingnan nyo, yan, di ba nakagitna? While on mandibular posteriors, their occlusal tables are lingually displaced. Okay? So from the occlusal or incisal, kapag maxillary, dito tayo, pag maxillary, you see equal amounts of facial and lingual surfaces. Okay? Kapag mandibular, hindi equal kasi nga nakalingual. More facial than lingual surfaces can be seen. 2/3 facial, 1/3 lingual lang yung nakikita. And that's the same for your posteriors. So you see equal buccal and lingual surfaces on maxillary, but on mandibular, you see 2/3 buccal and just 1/3 lingual. Reason for that, lingually displaced ang kanilang occlusal tables. Arch lengths in the maxillary arch, it's 128 millimeters. It's slightly longer. In the mandibular arch, it's 126 millimeters. So there's a 2 millimeter discrepancy. Okay, so let's now discuss your anterior teeth. They are very important for aesthetics and also for speech. They are required for the formation of V, F, and TH. Their inclination is facially because they are there to support your lips. Diba? That's why they are axially inclined. Now, number 20, when viewed from the sagittal plane, the axial inclination of anterior teeth, saan sila naka-incline? vertical. So vertical, straight lang. Eh, inclined nga, so wrong. Facially, mesially, distally, or lingually? Yes, very good. They are inclined facially. Letter B. Number 20, the correct answer is letter B. Okay, so let's discuss the differences between your maxillary and your mandibular incisors. Sorry, I forgot. Oh, sige, dito na lang. Madidiscuss din natin. So maxillary incisors are of course larger. They are wider. Ano yung rule natin kanina? Teeth are wider labiolingually than mesiodistally, except your maxillary, central, and lateral, and mandibular molars. So maxillary incisors are wider mesiodistally than labiolingually. Okay. Maxillary incisors have more distinct lingual anatomy. They have the same components. They have marginal ridges, cingulum, lingual fossa ridge, incisal ridge, but okay, they are more pronounced in the maxillary incisors. Maxillary incisors have rounder roots on cross-section than your than your mandibular incisors. Okay. Now let's discuss the incisal angles of your incisors. Okay. So mesio-incisal angles, okay, so tingnan natin yung mesio-incisal angles nila. Ito, 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 ito. Mesio-incisal angles are all sharp, all. For the incisors, all mesio-incisal angles are sharp, straight or straight. 90-degree angle. Okay, yan. Yan. But the disto-incisal angles for your maxillary and mandibular incisors are rounded. Yes. But there is an exception, di ba? Rounded, rounded, rounded. Except the disto-incisal angle of what tooth? Ano yung exception dyan? Yes, very good. Mandibular central incisor, because the disto-incisal angle of a mandibular central incisor is also sharp or straight. 90-degree angle pa rin. Okay? So marginal ridge length, ito na-discuss na natin. Ano ulit? Yung mas mahaba, mesial or distal marginal ridge? What is longer, mesial or distal marginal ridge? Yes, mesial marginal ridge longer than distal marginal ridge. Ano yung exception ulit? Except? Kasi equal. Mandibular? No. Marginal ridge sa incisors. Mandibular or anteriors? Mandibular, central incisor. Because it has equal mesial marginal ridge, okay, and distal marginal ridge. Do not confuse marginal ridge with cusp ridge. Iba yon. Okay, iba ang cusp ridge, iba ang marginal ridge. Okay. So maxillary incisors, incisal edge, center or off center? Nakagitna ba siya labiolingually? Or off centered? Hindi siya nakagitna. Nasa ng incisal edge? Less. It is centered labiolingually. Ito, mandibular incisors, incisal edge. It's off-centered towards the lingual. Okay? Off-centered labiolingually towards the lingual. Okay? Number 21, when viewing a maxillary central incisor from the mesial aspect of maxillary central, one normally finds the incisal ridge of the crown, ano dyan? Facial to the center, lingual to the center, on line with the center of the root in variable positions. Yes, very good. On line with the center of the root. This is true not only for a maxillary central incisor, but also for a lateral incisor and a canine. Now, if it's lingual to the center of the root, this is your mandibular anteriors. Okay, mandibular anteriors. Mandibular incisors, labial surface is straighter and flatter. Okay. They are also smoother. Yung labial surface nila, they are also smoother. Kaya nga, yung mandibular incisors, they are called your caries-resistant teeth. Kasi hindi lang yung labial nila ang smooth, pati yung lingual. So caries-resistant teeth. Because they have very smooth labial and lingual anatomy. Walang mga pits, walang mga grooves. Let's now discuss the maxillary central incisor. It is the most prominent tooth. It is the largest incisor lang ha, not the largest overall. It has the second longest crown. Second. What tooth has the longest crown? Oh, ito lumabas lang just recently. What tooth has the longest crown? Yes, very good. Mandibular canine. What's the third longest crown? Kung second ang maxillary, central. Yes, your maxillary canine has the third longest crown. And it has the widest crown mesiodistally among anteriors only. The widest crown mesiodistally among your anteriors. Greatest mesial CEJ of all among all your teeth at 3.5 millimeters. Okay. Greatest axial inclination. Remember, all anteriors are axially inclined, but the greatest inclination is seen on the maxillary central incisor. Only neighboring teeth, okay, with mesial to mesial surface contact, okay, together with your mandibular central incisor. You have the presence of developmental depressions. Again, developmental depressions separate lobes during development. Okay, so they separate lobes during development. Root apex curves towards the labial. Okay, root apex curve towards the labial. Yan. Root apex curves towards the labial. Kapag sa tiningnan natin siya from the facial or lingual, straight lang ang root. It does not curve towards the distal. Pero when you're looking at it from the proximal, you see an inclination of the root towards the labial. It has the roundest root form, therefore you could rotate it during extraction. So you could rotate it during extraction. Only maxillary tooth root that is as thick at the cervix as it is faciolingually. All other roots, aside from the root of your maxillary central incisor, they are wider faciolingually than mesiodistally. Wider faciolingually than mesiodistally. All roots at the cervical area. Pero yung maxillary central equal yung measurement niya faciolingually and mesiodistally on the cervical part, on the most cervical part of the root. Number 22, which of the following are anatomic features of permanent maxillary central incisors? May cingulum? Yes. May mamelons? Yes. May cusp ridge? Cusp ridge? Okay. Wala naman siyang cusp. Tingnan natin. Okay. Marginal ridges? Yes. Okay. So tingnan na natin. Yung A, pwede. Ito, B, C, F. Okay. So ito wrong na kasi may C. Wala naman siyang cusp. So wala siyang cuspal ridges. Tama? Okay. Ito rin. Wrong. Okay. So cuspal ridges. Okay. Wala. Marginal ridge. Yes. Cervical ridge. Meron. Okay. So may E. Okay. Triangular ridges. Meron bang triangular ridges? Okay, may iba. So, tingnan natin. Ito na lang kasi. Okay. A, B. O, ito kasi walang B. Okay, and E. Yan. Wala siyang cervical ridge. So, it's B, A, cingulum, mamelons. Wala siyang cuspal ridge. May marginal ridge. May cervical ridge siya. Wala siyang triangular ridge. Okay, so there is no triangular ridge. So number 22, the correct answer is letter B. Now let's discuss your maxillary laterals. Okay, the most common congenitally missing permanent anterior teeth. Most common sa anteriors lang. Third most variable tooth form next to the third molars kasi pwedeng maging microdont. or what you call your peg-shaped lateral incisor, microdont yan. Or pwedeng magkaroon ng dens invaginatus. What's the other name for dens invaginatus? Other name ng dens invaginatus. Dens indente, very good. Okay? Dens indente. Literally translated into tooth within a tooth. Pwede rin siyang magkaroon ng dens invaginatus. What's dens invaginatus in your lateral? Yes, very good. You call it the talon's cusp. Okay? Ano pa yung isang form ng dens invaginatus? What is the other form of dens invaginatus? Leon's premolar, yes. Which is more common, leon's or talons? Anong mas common? Leon's, yes. Okay, mas common sa premolar ang dens invaginatus kesa sa lateral. But if there is an anterior with dens invaginatus, definitely that's the lateral incisor. Number 23, which of the following anterior teeth exhibits the most deviation in crown morphology? O most deviation daw, ano yan? Anterior daw. Yes, that's your maxillary lateral incisor. Okay, most common tooth to have a palatoradicular groove, or other name niya is lingogingival groove, which is a groove that runs from the crown to your root or from enamel to cementum. Number 24, which of the following anatomic features of a maxillary lateral incisor will most likely complicate root planing? O tingnan natin. Bifurcated root, no. Mesial concavity, wala. Distolingual groove, okay. An extreme distal so may groove, okay. An extreme distal cervical line curvature. CJ curvature ba? No. It's a groove. Diba? Okay. Anong groove na yon? Yes. Distolingual, lingogingival, at palatoradicular groove. Okay. So the correct answer is letter A. Walang mesial concavity yan. Ang mesial concavity makikita nyo sa maxillary first premolar. It is a prominent feature of the maxillary first premolar. Tooth that is often in an abnormal relation and contact with adjacent teeth. Ectopic, nasusungkit. Okay? Ectopically erupted. Okay? Or sungkit. Okay? So it has rounded disto-incisal and mesio-incisal line angles. So you might ask, Dok, di ba sabi mo pag mesio-incisal sharp? Yes, ganun pa rin naman. Okay? Kasi hindi naman ganito to ka-rounded. So it still is considered sharper or straighter than the very rounded disto-incisal line. Root is the same length as the central with a tapered blunt apex curving towards the distal. So naka-distally inclined na yung roots. Okay, number 25. The maxillary lateral incisor is usually equal to or larger than the maxillary central incisor in which dimension? Root width facialingually, mas wide ba? No. It's the length, di ba? Crown, definitely hindi, mas maliit. Okay? Root length, yes. Crown length, hindi. Mas maiksi siya. So the correct answer for number 25 is letter D, the root length. Okay. It has the most developed lingual anatomy. So you have marked, pronounced mesial and distal marginal ridges, prominent cingulum with a deep developmental groove on the distal side extending to the root, your palatoradicular groove or lingogingival groove or distogingival groove. Deep developmental grooves within the lingual fossa, well-developed lingo-incisal ridge, okay? Lingual fossa more concave and circumscribed, okay? Now, ano pa? Presence of lingual pit. Nasa maxillary central incisor then. It may resemble the maxillary central or the maxillary canine from the incisal. Okay, now let's discuss your mandibular incisor. So there are 3 characteristics common to all mandibular anterior teeth. They have indistinct cingulum with smooth lingual anatomy. Kaya nga sabi natin, they are the least caries-prone teeth. So caries-resistant teeth na sila. Incisal edges not at the center, labiolingually it's lingual to the bisecting line. And you have a continuous convexity on the facial surface from crown to root. Okay, so let's discuss your mandibular central. It is the smallest tooth in the dentition. It is the narrowest tooth, narrowest mesiodistally and labiolingually. Most symmetrical tooth, so it's bilaterally symmetrical. Distal and mesial surfaces are the same. Greatest mesial CEJ contour among your mandibular only. First, succedaneous tooth erupt. Take note, succedaneous. Kasi ang molars, hindi yan succedaneous. And least variable tooth in the mouth. Okay? So again, it's bilaterally symmetrical. Okay, that's the most unique feature of this tooth. You have a single root whose length is the same or longer than the root of a maxillary central incisor. Okay. Mandibular lateral incisor, it's the second smallest tooth. Okay, so it's just bigger in all dimensions to your, a little bigger to your central incisor. Okay, so number 26, the crown of a mandibular lateral incisor compared to the crown of a mandibular central incisor. Crown daw ng lateral at central sa mandibular arch. In the same mouth is best described as wider, okay, di ba mas malaki, okay. Narrower, not symmetrical, smoother lingual surface, they are both smooth. So the correct answer for number 26 is letter A. It's wider mesiodistally kasi best described, okay. Now, incisal edge, okay, wait lang. Incisal edge follows the curvature of the mandibular arch. Yan. Kaya yung incisal edge niya from the incisal, so incisal view, the crown appears to be twisted on the root. Okay? At hindi straight yung kanyang incisal edge. Okay. Yan. Distal portion of the incisal edge has a lingual turn. Yan nga, nag-twist siya. So more of the lingual is visible from the mesial. Number 27. Which of the following is a distinguishing characteristic of a mandibular lateral incisor? Well, let's take a look. Incisal edge follows the arch curvature in relation to the faciolingual axis. Okay, follows arch curvature. Incisal edge is perpendicular, meaning 90 degree, no. Okay, it's sloping down. Diba? Hindi siya straight. Okay. Their cervical line curvature is greater distally than mesially, hindi. Mesial greater than distal. Incisal edge is lingual to the root bisector. Okay, lingual. Pwede. Yan. The mesiodistal dimension of the facial surface is narrower than that of the mandibular. No. Sabi niya, distinguishing. The distinguishing feature is the twisted crown. Okay, so ano dyan yung twisted crown? The incisal edge follows the arch curvature in relation to the faciolingual axis. Okay, resulting in a twisted crown. Okay. Root, longest root among incisors only, not overall. It's straighter, slightly longer, and wider than your mandibular central root. It has mesial and distal concavities with giving it an hourglass shape. So canines naman tayo. Okay, wait lang ha, I'll just drink water. Okay, so let's now discuss your canines, or what you call your cuspids. Okay, so they have one cusp. So they resemble the prehensile teeth of the carnivore. Prehensile pangkagat. Okay, they are the most stable teeth in the mouth. Bakit? Because they have the longest roots in the entire dentition. Okay, they are usually the last teeth to be lost kasi nga they are the most stable. Okay, they are very much anchored in your alveolar bone. They have a cosmetic value for two reasons. What are their cosmetic values? They create the canine eminence. Okay, that gives a facial expression on that area. So it's related to facial expression on that area. And then the other one is they are the cornerstones of the oral cavity. They are at the corners of your mouth. So they are the cornerstone of the mouth or the oral cavity. Again, differentiated from the cornerstone of the permanent dentition. Cornerstone of the permanent dentition, which is your mandibular first molar. Yes, very good. Okay. So let's compare your maxillary and mandibular canine. The maxillary canine is wider mesiodistally. Yan, wider mesiodistally than the mandibular. The maxillary canine is longer. Maxillary canine has more distinct lingual anatomy. Okay, the canine, maxillary canine may have a lingual pit, not all the time. Again, lingual pit is present all the time in a maxillary lateral incisor. Okay. Maxillary canine crown is in line with the root. Okay, so canine crown is in line with the root. Mandibular canine crown appears to be distally bent. Nakahilig siya towards the distal. Maxillary canine crown is short and fat. Mandibular canine crown, the longest crown, is long and slim. Okay, and from the proximal, the maxillary canine incisal edge is at the center labiolingually. While on the mandibular canine, it's lingual to a labiolingual midpoint. Okay, so let's now discuss your maxillary canine. It's the longest tooth. It has the longest cusp with tip centered on the root. It has the longest root. Siya lahat yung number 1 dyan, but it only has the third longest crown. Among your anteriors, it's the widest bacolingually. Widest bacolingually. Ang widest mesiodistally among anteriors ay maxillary central. But meron pa dyan overall later on. Talking about anteriors lang tayo. And least often extracted because of their long roots. Number 28, the longest cusp in the mouth is present on the, kasi kung minsan kung hindi nyo to alam, pag cusp, ang maiisip nyo agad yung molars, diba? But the longest cusp is present on the maxillary canine. Very good. Prominent labial ridge. Again, labial ridge is seen only on maxillary canines, and it's more prominent on the maxillary than mandibular. And because of these, you have developmental depressions. Yan, merong developmental depressions, giving it a 3-lobed appearance. Ano yung tatlong lobes na yan? Mesial, distal, middle. Now, ano dyan yung most developed? Middle. Most developed. And it contains the cusp tip. Yan. The middle lobe is the most developed, containing the cusp tip. Okay, lingual ridge. Again, it divides the lingual fossa into mesial lingual fossa and distal lingual fossa. Okay. The form of the crown is a compromise from anterior to posterior teeth in the dental arch. The mesial section looks like an anterior tooth, showing a crown portion with a greater labiolingual bulk. The distal portion looks like a posterior tooth because it appears to be stretched to make contact with the first premolar. Number 29. When compared to the maxillary central incisor, the maxillary canine, so you're comparing central and canine in the maxillary arch, normally exhibits which of the following? Shorter root? No, the maxillary canine has the longest root. Wider crown mesiodistally. This is for the maxillary central incisor. Thicker crown labiolingually. Yes. Okay. Longer crown incisogingivally. No. It's the third longest crown. Third longest lang siya. Second longest ito. Diba? Shorter crown and shorter, yes, shorter crown but not shorter root length. So the correct answer is it's thicker crown labiolingually. Again, maxillary canine is the widest anterior tooth labiolingually, while the maxillary central incisor is the widest anterior tooth mesiodistally. Okay, so that's the difference. Now, let's move on to your mandibular canine. It has the longest crown, and if there is an anterior tooth that might have two roots, anterior with a bifurcated root, that's your mandibular canine. Mesial outline of the crown and root is a straight line. So from crown to root, it's nearly a straight line. Number 30. The mesial surface of the crown is almost parallel to the long axis and the root. O mesial surface ng crown is parallel to the long axis of the root on a first premolar, maxillary first premolar, second premolar, mandibular, canine, maxillary or mandibular canine. Ano yung straight line, ang kanyang mesial surface? Crown to root? Yes, that's your mandibular canine. It's a distinctive feature. Letter D. Mesial surface ng crown is parallel to long axis of the root. Okay, letter D. Appears to be distally twisted on the root base, so nakahilig siya. It's not, the crown is not straight, nakahilig siya. Okay. The root seldom curves, but if it does curve, so usually straight lang siya. Pag may curvature siya, it curves towards the mesial, not distal like any other roots. Most roots natin naka-incline distally. Pero pag ito, nag-curve yung root, it's towards the mesial. We have the presence of a lingual ridge but not as prominent as that seen on the maxillary canine. So it is more symmetric than the maxillary canine. Wala siya yung pinching of the distal surface. Now, let's move on to your premolars. Number 31, the total number of premolars in one arch of the dentition, one arch, okay, is normally the same as the total number of which of the following? Okay, primary premolars. There's no such thing as primary premolars. Canines, in a primary dentition, ilan ba? Ilan ba ang premolar sa isang arch? Ilan? How many premolars in one arch? 4. Very good. Ilan ang canines natin sa isang arch? Primary. Ilan? 2. So hindi pwede, wrong. Molars in the primary dentition? Yes, 4 din yan. Permanent molars in one quadrant? 3 lang to. Permanent anterior teeth in one quadrant, 3 rin. So the correct answer is letter C. Because remember, your premolars replace your primary molars. So the correct answer for number 31 is letter C. Okay, so let's now discuss your maxillary premolars. A posterior tooth has a facialingual crown dimension, yan, greater than its mesiodistal crown dimension. Facialingual greater than mesiodistal. Okay, so hindi pwede. Ano bang posterior yung hindi nagfa-follow dito? Mandibular molars. Kasi ang mandibular molars, mesiodistal greater than facialingual. Mandibular molar, wrong. Okay? So, nakatanggal na tayo ng isa. So, facialingual greater than mesiodistal. It is a maxillary tooth. Okay? Actually, halos lahat naman. Okay? And you have 2 roots. First premolar, 2 roots. First premolar, 1 root. Tama, ganito siya, pero 1 root lang. Second premolar, tama, facialingual greater than mesiodistal, but 1 root lang. Maxillary second molar, Tama, faciolingual, greater than mesiodistal pero 3 roots. So the correct answer is letter C. Okay? Letter A. Your maxillary first premolar. It's wider faciolingually than mesiodistally and it has 2 roots. Okay? Kasi ito, wider faciolingually than mesiodistally pero 1 root. Ganon din to, mandibular first molar mesiodistal greater than faciolingual and you have 2 roots. Maxillary second molar faciolingual greater than mesiodistal pero you have 3 roots. So letter A. So the first premolars, what are the characteristic of the maxillary first premolar? Largest and widest premolar and only permanent tooth with a mesial cusp ridge that is longer than the distal cusp ridge. Ito yung cusp ridge. Iba siya sa marginal ridge. Okay? So yung rule natin, distal cusp ridge is always longer than mesial cusp ridge. Okay. Only premolar with 2 roots and a long root trunk. So ano yung dalawang roots niya? Buccal and lingual. Lingual cusp is shorter. So you have 2 cusps. The lingual cusp is shorter by 1 millimeter and it is also narrower. So it's smaller and shorter than the buccal cusp. So you could see both cusp tips from the lingual because of that arrangement. Mas maliit yung lingual cusp. Buccal cusp tip is sharp and it points to the distal. Palatal or lingual cusp tip points towards the mesial. Magkaiba sila ng direction. Okay? And so longer cervico-occlusally. Among your posteriors, the first premolar has the longest crown. Among posteriors lang, ha? Not all teeth. Among posteriors, among maxillary, wag na, parehong posteriors. First premolar has the longest crown. Again, posteriors lang ulit. Okay, so it's longer cervico-occlusally than the second premolar, the first and the second molar. You have a prominent buccal ridge. Oh, ito yung buccal ridge. It also has a 3-lobed appearance kasi may developmental depressions din siya. Okay, so you have again mesial, distal, and a middle lobe. Okay, the middle lobe is the most developed. Okay, containing the cusp tips. The cusp tip from the buccal. Okay? Yan, broad-shouldered tooth kasi wider ang kanyang buccal than lingual. So buccal is wider than lingual. So it's called the broad-shouldered tooth. It has a hexagonal crown profile and a trapezoidal occlusal table. You have a well-developed groove, okay, and a mesial. So this groove joins the mesial marginal developmental groove. Okay, so fuse na siya sa central groove. Okay, I'll just move this. Okay, yan. So the mesial marginal developmental groove continues towards the proximal surface, the mesial surface. It has no supplemental grooves and no central pit, but there is a developmental groove. Okay. Number 34, for an amalgam restoration, it will be most difficult to obtain close matrix band adaptation on which of the following surfaces? Okay, bakit kaya? Okay, so, na-answeran ko. It's the mesial of a maxillary first premolar. Why? The mesial of a maxillary first premolar has a mesial developmental depression on the crown and on the root. Okay? So yan yung isa sa mga characteristics ng maxillary first premolar. Hindi lang siya merong mesial marginal groove, developmental groove that runs from occlusal to mesial surface. Meron din siyang mesial marginal, mesial developmental depression on the crown and on the root. Okay? Yeah, so hindi mo ma-adapt very well yung matrix band. Okay, for a while lang class, inom lang ako, nauubo lang ako for a while. Okay, so number 33, the correct answer is letter A. Okay, so let's now discuss your second premolar. Okay, so you have more equal height and width on both cusps. Yan. And the tips are now centered on the root. Di kagaya kanina sa first premolar, yung buccal cusp naka distal, yung lingual cusp naka mesial. Ito centered on the root. Okay? It's narrow-shouldered kasi equal yung kanyang buccal and lingual widths. Okay? Buccal cusp is shorter, okay, and rounder. It's not pointed, just like the cusp tip of the first premolar. Okay, you still have a buccal ridge. You still have lobes, but they are not distinct. Both buccal ridge and lobes are not distinct. Crown outline, it's ovoid or round. It's more symmetrical and less angular than your first premolar. You have a short central groove with more supplemental grooves. Okay, number 34. A distinguishing characteristic of a maxillary second premolar is the presence of two distinct roots. Dalawa bang roots ng maxillary second premolar? No. Okay? Mesiolingual groove. Wala rin. Okay? Ang mesiolingual groove class nasa mandibular first premolar. Two distinct roots, maxillary first premolar. Lower lingual cusp than facial cusp? No. Okay, a longer. This is your walang premolar na ganon. Okay? Concavity of the mesial crown surface. Okay, concavity. Short central groove mesiodistally. Yes, the correct answer is letter E. You have a short central groove with numerous supplemental grooves. Okay. Greater distance between cusp tips. Okay, so you have a wider occlusal surface buccolingually on the second than on the first. Now let's move on to your mandibular premolars. There are three characteristics that distinguish mandibular premolars from maxillary premolars. From the proximal view, mandibular premolar crown still lingually, di ba? Kaya nga ang occlusal tables ng mandibular posteriors wala sa gitna. It's towards the lingual. Mandibular premolar lingual cusp are much smaller than the buccal cusp. From the occlusal view, the mandibular premolars are more square. Okay, di ba? More square sila. Okay, so let's now discuss the mandibular first premolar. It is the smallest premolar. It has the greatest lingual inclination of the crown from its root. And greatest lingual inclination. It has a mesiolingual developmental groove. It has a transverse ridge, so wala siyang central groove. It's the only premolar without a central groove. Okay, yan. So wala. Meron lang siyang, it only has mesial and distal fossa. Kaya nga ang tawag niyo sa kanya, snake's eye. Diba? Snake's eye appearance. Okay. Number 35. Which of the following grooves on a mandibular first premolar originates in an occlusal pit and extends onto a proximal surface? May grooves daw, mandibular first premolar. Okay, so from occlusal pit to the proximal surface. Ano yan? Mesiolingual developmental, distolingual developmental, mesial marginal, and lingogingival. Yes, that's the mesiolingual developmental groove. Okay, it's very asymmetric, mesial and distal profiles with a prominent mesial bulge. Yan. Okay, kaya nga they liken it to canine and a premolar as well. Okay, canine and molar. Okay, so sa mesial, you have the mesial bulge. Okay, ito yan. So you have the, what do you call that? you have the stretching, okay, on the mesial. Okay? Yung distal niya, so yung mesial niya, itong tooth na to is what do you call that? Transitional tooth din. It has qualities that look like an anterior and qualities that look like a posterior. Okay. Lingually inclined occlusal table. Okay. Greatest discrepancy in the size of buccal and lingual cusp. Ito, tsaka ito. Okay, di ba? Mas maliit si buccal cusp kesa sa lingual cusp. And the lingual cusp is shaped like a cingulum. Number 36. The lingual cusp on which of the following mandibular posterior teeth is approximately 2/3 the height of the respective facial cusp. Ano dyan yung maliit ang lingual cusp? First premolar, second premolar, first molar, second molar, third molar. Yes, it's your mandibular first premolar. Because again, your lingual cusp looks like a cingulum. Okay. So these are characteristics that make it resemble the mandibular canine. The buccal cusp is long and sharp and is the only occluding cusp. Okay. Buccolingual measurement similar to canine. Yan, buccolingual. Occlusal surface that slopes sharply lingually in a cervical direction. Okay. So those are similar to canines. Mesiobuccal cusp ridge is shorter than discobuccal cusp ridge, yes. Okay, so that's also true for your mandibular canine. Outline form of the occlusal aspect resembles the outline form of the incisal aspect of the canines. Magkamukha sila from the incisal. Sorry class, ang kati talaga ng throat ko. Wait lang. Okay, yan. So, magkamukha sila. Kaya nga ito, transitional tooth. Kamukha niya ang canine, kamukha din niya ang premolar. Sa maxillary, ang transitional tooth natin, yung canine. Kasi yung mesial half niya mukhang anterior, yung distal half niya mukhang posterior. Ito naman, sa mandibular arch, ang transition from anterior to posterior, yung mandibular first premolar. It looks like a canine and at the same time, a second premolar. Okay. So, number 37, which of the following anatomic characteristics distinguishes a mandibular canine from a mandibular first premolar? Okay, ano yan? Presence of a facial cusp. Yan, distinguishes daw a canine from a first premolar. Facial cusp, o pareho naman silang may cusp. Okay, distinguishes, so no. Occlusal table. May occlusal table ba ang canine? Wala. Okay, so ito pwede. Bifurcated root? Hindi. Pareho silang one root. Mesiodistal width of the crown? Pareho din. So hindi pwedeng distinguishing. Steepness of the mesial cusp angles? Pareho lang. Kaya nga magkamukha. So the correct answer for number 37 is letter B. So they both have a facial cusp, they have a single root, they have the same mesiodistal width of the crown, and they have both steep mesial cusp angles, but a mandibular canine does not have an occlusal table. Diba? Ang first premolar lang ang may occlusal table. So these are characteristics that make it resemble the mandibular second premolar. Outline of crown and root from buccal resembles the second premolar, except that the buccal cusp is longer. Yan, di ba? Magkamukha sila, pero ito longer. Again, among posterior teeth, posteriors lang ha, from premolars to molars, ang longest crown nasa first premolar. Longest crown. First premolar. Longest crown. Yan. Kaya ito, longer than the second. Contact areas are near the same level. Saan ulit ang contact level? Contact areas ng premolar. Mandibular premolar. Pag posteriors, nasa ng contact? M. Yes, very good. The middle, third. Mesial and distal cervical line curvatures are very similar because it's almost flat. Okay? It's not that curve in your posteriors. And you have the presence of more than one cusp, 2 sa first premolar, 2 or 3 sa second premolar. You have a well-developed middle buccal lobe, so lobed appearance ulit. Okay? Kasi meron siyang mesial, may distal lobe at may middle lobe. Again, this is the most developed. Ayan. With ending in a pointed buccal cusp. Okay? It carries the cusp tip. And you have a prominent buccal cusp ridge. Measurement mesiodistally at the cervical line is less than the measurement at the contact area. So you have cervical constriction. Yan, cervical constriction. Crown and root exhibit lingual tapering. Yan, mas narrow siya sa lingual. So you could see mesial and distal surfaces of the crown and the root. Diamond, outline form. Diamond, outline form. Okay. Buccal cusp tip is centered over the root tip when viewed from the mesial. Distal marginal ridge is more coronal, di ba? Mas higher. Yan yung diniscuss natin kanina. Usually, ang distal marginal ridge more cervical than mesial. Pero this tooth, opposite. More cervical marginal than distal. Okay. Distal marginal ridge. Yan. So, distal marginal ridge is higher. This is your mesial marginal ridge. Okay. The second molar. Okay. It is the most congenitally missing premolar. Okay. Most congenitally missing premolar. Buccal width and lingual width are equal in size. And it is the only premolar with a central pit and a central fossa. Okay. It assumes two forms. You have a 2-cusp form and a 3-cusp form. Yung 2-cusp, pwedeng H and U pit and groove pattern. 3-cusp natin ay Y, pit and groove pattern. The H, the U, the Y tells you about the pit and the groove pattern. Number 38, which of the following premolars usually has 2 lingual cusps? Usually has 2 lingual cusps. Okay? Ano dyan? Lingual cusp. Yes, your mandibular second premolar. Ito, tigi-isa lang ang lingual cusp nila. Okay. So it resembles the mandibular first premolar from the buccal. Ano yung difference? Ang mandibular first, longer ang crown at sharper cusp tip. Okay, single root, which is larger and longer, so larger and longer than that of the mandibular first premolar. Buccal cusp is equal to the lingual cusp. Yan. Okay, so yung size, pati yung size, okay, yung width, pareho. So you could see, because the lingual cusp is more developed, you could see little occlusal surface from the lingual. Unlike to, nakikita mo siya. Yan. Okay. So for the 3-cusp type, okay, you have the largest buccal cusp, the second largest mesiolingual cusp, and the smallest is the distolingual cusp. You have well-developed triangular ridges on each cusp, separating each cusp are developmental grooves that converge at the central pit, forming a Y shape. Kaya Y-type premolar. So differences from first premolar, crown and root are wider buccolingually. Yan, crown and root. Shorter buccal cusp that is not centered over the root trunk. Ito kasi naka-center, yung sa first. Ito, hindi na siya nakikita sa center ng root trunk. Lingual lobe development is greater. Okay, so you have a more developed lingual cusp. and less of the occlusal surface may be seen, okay, from the lingual. Yan. So no mesiolingual developmental groove. The root is longer than the first and the apex of the root is more blunt. So you could also see more occlusal surface, okay, on the distal due to distal tipping of the crown. Okay. So buccal cusps, they are shorter, wider, and not as sharp. They are blunter. Cusp loops are less steep. Okay, so ito yung mga cusp loops. Okay, they are less steep. The root is thicker and longer than the root of the mandibular first. It has the roundest root among premolars on cross-section, and the apex is closest to the mental foramen. So roundest root on cross-section and apex is close to the mental foramen. Okay. Now let's just discuss the maxillary first molar kasi magto 12 na. Okay? Baka hanggang second molar kaya. Okay, so we'll continue this next time. So let's compare first maxillary molars and mandibular molars. Maxillary molars have 3 roots, mandibular molars 2 roots. So number 39, which of the following best describes the root lengths of a maxillary molar? Di ba na-discuss ko kanina? Palatal, longest, distobuccal, shortest. Okay. Lingual root is the longest, okay, and distofacial root is the shortest. Okay. Lingual root longest, mesophacial root shortest, no. Mesophacial root longest, no. So the correct answer is letter A. Okay. Roots are not of the same length, definitely. Lingual root is the longest, followed by the mesobuccal root, and the shortest is the distobuccal root. It has 3 major cusps. Ano yung tatlong major cusp niya? Mesobuccal, distobuccal, mesolingual. 3 major cusps. Yan. Okay? Ang mandibular molars, 4 major cusps. So mesobuccal, distobuccal, mesolingual, distolingual. On a maxillary molars, the cusps, both buccally and lingually, are not equal. But on a mandibular molars, the cusps are equal, buccally and lingually. Occlusal table centered on a maxillary molar. On a mandibular molar, it's towards the lingual. Maxillary molar is wider facialingually than mesiodistally, while a mandibular molar is wider mesiodistally than facialingually. Lingual height of contour. O basta lingual height of contour, middle third. Middle third. General, okay, middle third. Middle third. Nandito siya, middle. Pag maxillary molar, it's just above the junction of the cervical third and the middle third. So nandito siya. Okay? Ay, wait lang. O, tama, lingual. Okay? O, di ba? Kita niyo naman. Pag naman mandibular molar, the lingual height of contour is just below the junction of the occlusal and middle third. So dito. So nasa middle third pa rin siya. Magkaiba lang ng location sa middle third. On maxillary molars, you have a distolingual groove. On mandibular molars, you have a buccal pit. So let's discuss the maxillary first molar. What are its characteristics? It's the largest overall. Among your maxillary, it's the largest. Also, widest tooth buccolingually. Only tooth that is broader lingually than buccally. So it exhibits usually, ang ngipin natin class, narrower sa lingual. Mas maliit sa lingual. Pero ito, mas maliit naman yung buccal. Okay, second, permanent tooth to erupt. Only tooth with 2 triangular ridges on one cusp. That's the mesolingual cusp, forming the transverse and the oblique ridges. Okay, now when it comes to cusp size, the largest is the mesolingual cusp, followed by the mesobuccal, then the distobuccal, and the smallest is always the distolingual cusp. Okay. Now when it comes to cusp height, the mesolingual is still the longest. Distofacial is your second longest. Mesofacial is the third longest, and the shortest is distolingual. So the distolingual cusp is small, the shortest and the smallest as well. only tooth with a pronounced distal concavity. Yung maxillary first premolar, meron siyang mesial, okay, developmental depression. Ito, distal developmental depression or distal concavity. From the occlusal, the outline is rhomboidal. Okay, so obtuse angles. Okay, ito yan. Pag obtuse, greater than 90 degree. So you have your mesiolingual and disobucal. Okay? Para hindi niyo siya makalimutan yung obtuse angles, yung oblique ridge. Ano ang kinoconnect ni oblique ridge? Mesiolingual and disobucal. Right? And acute angles naman sa mesiobuccal and disolingual. Central groove, okay, visual to the oblique ridge, running from central pit. Yan, ito si central pit to the mesial pit. So that's your central groove. Okay, so number 40, which of the following grooves on a maxillary first molar runs from mesial pit to the central pit on the occlusal surface? Yes, mesial pit to central pit, that's your central developmental groove. Okay, distal groove, ito naman si distal groove from central pit toward the oblique ridge. Actually, may distal groove dyan. Ayan. So distal groove, I mean, ito yung distolingual groove. Okay. Number 41, the central pit of the maxillary first molar is formed at the bases of the triangular ridges of which cusp? O, nasan yung central pit? Ito si central pit, anong cusp yan? Mesiobuccal, mesiolingual, distobuccal. Okay? So mesiobuccal, mesiolingual, distobuccal. Mesiobuccal, mesiolingual, hindi kasama si distolingual. Mesiobuccal, distobuccal, distolingual. Okay, wrong. So the correct answer is letter A. So the central pit is surrounded by what cusp? Mesiobuccal cusp, mesiolingual cusp, and distobuccal cusp. It has a long buccal groove separating the two buccal cusps, mesiobuccal and distobuccal, with a central pit. Okay, only two roots. Tatlo ang roots ito, but from the mesial view, you only see two roots. Mesiobuccal and palatal. Why? Because the distobuccal is shorter, okay, than the two other roots. Three roots, but you have fourth canal. Okay, so the fourth canal is in the mesiobuccal root. Okay, so ang mesiobuccal has two roots. Then one on the palatal, one on the distal. Okay, and apices are closest to the maxillary sinus. So what is your precaution? Whenever you are extracting this tooth, do not apply too much apical force because you risk perforating the very thin bone, okay, forming the floor of your orbit. Diba? Okay, so do not apply too much apical force. Mesiobuccal and distobuccal roots, yan. They are not parallel, okay, but they have a pliers handle-like, okay, appearance. Okay, yan, para silang ganyan. Lingual or the palatal root is the third longest root in the maxillary arch. Apex is in line with the lingual groove, okay, and it has a vertical longitudinal depression, okay, from the cervical line. Okay, now we will be continuing our discussion on the 18th. Okay, so hopefully matapos ko siya in 2 hours. Yan. Okay, nasa number 39 pa lang tayo. Tama ba? 39. 41. At isa ka 41 na tayo. Yan. Okay, so I'll see kung paano ko mapapa-ikse yung iba. Kasi we only have 2 hours. Okay, so I'll really try my best, okay, to finish it. Kasi alam ko may hapon pa kayo. Okay, so I'll just take a look at how the remedy for that. Okay, so for the meantime, okay, paano yung di natin natapos sa sagutan sa FC? Meron pa tayo. Meron pa tayong isang meeting, 2 hours. Okay, meron pa. Sa 18. Okay, we still have 2 hours. So 4 hours yung 18 natin, 2 hours for oral ANAFI and 2 hours for oral histo. Okay, so we still will continue this next meeting. Yan. So I'll try to finish. Okay, syempre gusto kong matapos lagi. Okay, especially yung rationalization. So don't worry, hindi dito nag-e-end ang oral ana. May 2 oras pa tayo next week. Okay? Yan. So we will end our discussion here. Okay. So for the meantime, okay, maghihiwalay-hiwalay muna tayo, and next week, okay, we are going to see each other again. But of course, before we end our meeting, I would like to ask you, syempre, future licensyados, top-ranked doctors, what's your goal? Okay, anong goal natin? To top the board exam. Okay, ulitin ulit natin. Okay, future licensyados. So I will not call you doctors kasi you are all doctors na. You are graduates of doctors of dental medicine. But okay, you want to have your licenses so you could practice. That's why I'm asking you, future licensyados, top-ranked doctors, what's your goal? To top the board exam. And that's all for today. Okay, I'll see you again next week. So I hope marami na kayong natutunan dun sa first few na discussion natin, and more to come pa, okay, pagdating natin next week. So see you next week. Goodbye everyone. Stay safe. God bless you.